Half a day, everyone. Thank you for coming today. So this is the Committee on Health, Tourism, Historic Preservation, Land and Justice. It's a public hearing. This is October 3rd, 2019, and it's 5:09 p.m. Notices for this public hearing were disseminated via email to all senators and all main media broadcasting outlets on Thursday, September 12, and again on Monday, September 16, 2019. The notice was also published in the Guam Daily Post on September 12 and September 17, 2019. An invitation was sent to the Guam Medical Association on September 15, as well as the Guam Medical Society on September 16. And we had asked them to invite all their members. I would like to acknowledge the presence of my colleagues. We have Senator Kelly Marsh Taitano, and we have Senator Terlaje. Thank you, colleagues. This is an informational hearing on the Guam Medical Malpractice Mandatory Arbitration Act and the impact on medical practice, standard of care, and the availability of health professionals on Guam. On September 19, we had the first hearing, and all testimonies from that hearing are on the website senatorterlaje.com. There's also a link to the hearing that you can watch, the audio and the video. The Attorney General and all members of the Guam Bar were invited to that hearing, and the public was also invited to submit testimony. For today's hearing, health professionals have been invited, and we've asked them to focus on the impacts of the current law on their practice, on whether the law ensures the appropriate standard of care on Guam, and the impacts of the law on the availability of qualified health professionals. I've invited the heads of the Guam Medical Association and the Guam Medical Society to lead the health professionals panel, and all their members to follow. And we will also hear testimony from additional attorneys who were not able to make the first hearing. And we have members of patients here also to testify, and members of the public. At the end of this hearing, I would invite each of you to a third hearing, or to at least submit testimony for our consideration at a third hearing on November 7, 2019 at 2 p.m. The committee is particularly interested in your input as to whether the law can be improved to better protect patients and to ensure an appropriate standard of care. These hearings are for informational purposes only, to allow senators to hear suggestions and make inquiry towards formulation of legislation. The third hearing will also allow testimony from the general public. Note that as of today, no bill has been introduced during this legislative term to revise the current Medical Malpractice Arbitration Act. A separate public hearing on any bill that might be introduced to specifically amend the law will be required. So we are now going to invite Dr. Blounce, but I don't think he's here right now, or a representative from the Guam Medical Society. And otherwise, yes, so Dr. Wen from the Guam Medical Association to begin.
Okay, thank you, Senator, for accommodating the time change to allow our physician to attend this medical arbitration law. It's important because we have patients that we schedule ahead of time, so thank you so much for that. Today we really have a full panel of physicians from different sectors practicing in Guam who will share their thought and concern on any change to the mandatory medical arbitration law that to us is most likely impact really the quality of medical care in Guam. We have I think 7 of us here on the front, so if you can hold off on any question until the last person, they have a lot to say, so I appreciate that very much. Again, my name is Dr. Huang Nguyen, and I represent the GMA as a board member, and also as a private medical practice here in Guam since 2005. There's a lot of pro and con to using arbitration to resolve a medical malpractice claim. And sometimes the patient may or may not have a choice. With the rising cost of the healthcare and the health insurance, a lot of states have tort reformer that always looking for a way to reduce the burden that medical malpractice case placed on the healthcare industry. Now, I have been practicing Guam since 1995 with the Air Force, and throughout my practice, I have the privilege to take care of thousands of patients over the past, since 1995, with some of my family under my care that consisting of a 4 generation. They trust the physician, they coming back, and I say, 4 generations make you look very old, but that's what happened. As a physician, we really choose this profession knowing that we sacrifice a lot of time, including our family. It does not matter if you are on and off island, the patient can always get a hold of you. As the digital age happened, they call you on a cell phone and on WhatsApp, so they always can get a hold of you. And the patient are actually part of your second family. Your family at home, with the patient, your second part of the family. That's how profession look. You go off island, you actually miss them. You want to come back because they miss you. So that's the trust that they have in you. That's probably the true reason why most of the physicians, we don't retire. We practice until the end. That's because that's our family. Back to the mandatory medical arbitration law, I really like to change the thought or belief that this law is there to protect the physician. That is not the intention of the law. The medical arbitration law is there to protect the patient in the state and territory. Now, if you look at the history and review all the medical practice in the state, most of the states have arbitration law and cap on the malpractice in order to retain the physician in the state to provide the health care for their resident. I'm not sure why we're going backward and try to change something that has been challenged 2 or 3 times in court and determined legal under our Constitution. It doesn't make sense. We are in a location that is far, far away from the mainland, and recruitment of physicians are so hard to get them to come out here. Most of the physicians have no idea what Guam is, and the distance from the mainland really discouraged them from practicing Guam. And from the business standpoint, the most common question the physician asks you in the interview is, do we have to practice defensive medicine? Defensive medicine is detrimental to the patient as it drives the cost of medical care upward and do more harm to the patient than helping them. And the cost of the medical care would not be in reach for the majority of our patients. There's many times that we order lab and study on our patient, and they can't afford it just because you want to practice defensive medicine. The mandatory arbitration law is the best selling point for our recruitment, as physicians are tired of beating up by frivolous lawsuits in the state, ending on settlement by the insurance company without a day in court to prove that it is or is not a malpractice. They just settle and get out of the way. We definitely will have problem recruitment if significant change on this law occurs. So shortage of physician, we're going backward 10, 20 years and be very detrimental to Guam. Just imagine, a few years ago, we don't have an orthopedic surgeon. So you don't have orthosurgeon, you don't have neurosurgeon, you don't have ENT, you don't have OB, you don't have cardiologist, you don't have oncologist that we have right now. And the key here is, our list of specialty are growing since 2005 due to the current practice condition in Guam. But if the law change, all the specialty will leave Guam. And again, back a few years ago, I have a fracture and I can't send no one because there's no ortho on island. So if you want to drive those people out, that's one way we're going to do it. Now, regarding the cost of arbitration versus a court case, last hearing, we have a debate which one's cheaper, but arbitration if you surf on the internet, it's a lot cheaper and a lot faster. You know, Dr. Joey Helms, I think he forwarded a fee schedule arbitration from AA to you and from the last legislative hearing there. And, you know, for comparison, you know, arbitration timeline costs like 3 to 6 months, and, you know, based on complexity of the case, and it costs anywhere from 10 to 30,000 if I reviewed the case correctly on this fee schedule there for AA. But, you know, on a court case, it's going to tie up 1 to 2 years, and it takes us a lot of time away from our patient care, and the cost is outrageous, you know, over 100,000 easy, you know, I mean, so it's really take a long time. You asked if you have malpractice insurance in Guam. Yes, we do. Malpractice insurance is available in Guam at this time, and the cost is less than the state due to our mandatory arbitration law and due to non-litigious population. The people here don't know, it's not in the right mind to sue very much, so the cost of insurance is lower. But if any change on this law, the cost of malpractice insurance will most likely not obtainable from any physician. It's going to be skyrocket. And the outcome is, if the malpractice insurance company pull out of Guam due to the low number of physicians, we don't have like 200-300 physicians here compared to a state that have thousands of physicians. They might pull out, and we don't have any malpractice insurance. Again, with that in place, our practice will be changed a lot. We'll be cherry picking which patient we will see and which patient we will not see. Doesn't matter what it is, because if you have a high-risk patient that really need your care, you don't want to pick them up, because now you put yourself at risk for a lawsuit. So you're going to have all this sick patient in Guam that will have no home to go to. Now, in our profession, we really accept in some occasion that ending an inevitable loss of life for our patient despite the best effort we can do. In those occasions, we really sadden with the patient. Again, they are our second family. You know, we don't want to lose them either, but that's something that's part of life, and we learn to adapt to our loss and move forward to the next patient, but we do not like to lose any patient. You know, I really ask you, as senators, to make decisions really based on logic and reality, and not based on empathy for a few, because the decision you make really affect the whole population of Guam. People can't afford to go somewhere if they need the specialty. There's a lot of specialty in this room, and if they all move off island, we really in trouble. I'm going to be in trouble. I have no one to refer my patient to for the care of for my family. So it's just really, you have to make a decision, based on evidence and not just on empathy of someone. So I just ask you to consider, regarding when you make decision of this mandatory arbitration law. Okay.
Thank you, Dr. Nguyen.
Thank you.
Should we go? Did you suggest? Is Dr. Blount's here?
I don't see him.
Okay.
Here,
so we will proceed.
Dr. Berg.
I have Dr. Phil Tutnauer.
No.
Oh, sure. Yeah, please. Yes. So, please state your name for the record, and then you may proceed.
Thank you, Senator. I'm Dr. Nancy Lentz.
I'm sorry, just can you say it again loud?
Nancy Lentz.
I can't hear you. Is that on? Yeah. All right.
Dr. Nancy Lentz.
Thank you.
As I said, I'm a member of the Guam Medical Society, and in the stead of Dr. Blount's tonight, I would like to read the statement that we have prepared. The Guam Medical Society is comprised of physicians, chiropractors, dentists, podiatrists, nurses, lab workers, and other allied health professionals. We have held 2 meetings to discuss the issue, and our members have agreed on a position that the society will take. We believe the requirement for arbitration is needed and is beneficial to Guam and its citizens. However, we believe the legislature should look into ways to reduce the financial burden to Guam's people. Negative effects of repealing this requirement include several factors. It would decrease the number of physicians willing to practice, thus reducing the population's access to providers, as we just heard. Some specialties or subspecialties with higher premiums may leave the island altogether. On the mainland, these higher cost services include orthopedic surgery, as well as OBGYN and neurosurgery. Clinic and government costs would rise to cover the increased costs of malpractice insurance. These costs would be passed on to the patients and make healthcare more expensive. On Guam, there's a lack of providers in some areas, most pediatric subspecialties and some adult services. To make up for this, the island's providers provide care to these individuals, but technically in doing so, we are practicing outside the scope or at the edges of our training and could be held accountable. Should the current arbitration law be repealed, physicians would be less likely to perform those services, and some patients would have to go off island for care that could be handled here. Can you hear me? This again would increase healthcare costs. Repealing this law would hurt the people of Guam. The current law helps protect physicians from soaring malpractice costs. Several states in the mainland have a malpractice crisis and out-of-control fees. Should this be repealed on Guam, the same could happen here. The current arbitration requirement helps to deter frivolous lawsuits, which lead to increased healthcare costs. It also protects the record of physicians who are practicing here in good faith and allows us to sometimes provide services that would normally be handled by specialists that are not available here, preventing some of the need to leave island for care. Guam allows suits against Guam Memorial Hospital, but some states, Virginia for example, invoke sovereign immunity, and the state-owned hospitals cannot be sued. The current legislation helps protect physicians, but does not prevent patients from seeking justice. The Guam Medical Society believes that arbitration access can be increased through several actions. First, many cases in the mainland are taken by our attorneys, by attorneys, even if the plaintiff cannot pay. The cases are taken on, and then the fee is taken out of any award at the conclusion. Guam lawyers should be encouraged to take on a case if someone was clearly hurt or wronged, as the money they pay up front for the arbitration can be recovered from a successful outcome. As the attorney would be providing upfront fees, it would discourage frivolous suits that would not likely succeed, protecting providers and keeping costs down, but would allow for true cases to proceed, protecting the patients and those potentially harmed. Second, we could look closer at other options for arbitration. Instead of coming from the mainland, we could see if such service providers could come from the Philippines or elsewhere in Asia or Hawaii. Local physicians could also be tasked for this role, or looking over TV web-based arbitration similar to telemedicine. It should also be noted that there are options for those with limited financial means to seek assistance with the current process. This could be expanded if the government of Guam sets up a fund to assist those in need to obtain arbitration services. Physicians have certain yearly fees to maintain their practice: hospital privileges, state licensure, controlled substance permit, federal DEA license. A portion of these fees or a new fee could be used to establish a fund to help patients. The government or a panel agrees is of limited means and should receive arbitration. Several steps could be taken to continue the arbitration process and protect physicians while driving the costs down and improving access. The Guam Medical Society is dedicated to improving healthcare on Guam, and we feel that overturning the requirement for arbitration would have a negative impact on the island's healthcare. It would lead to fewer services, more off-island referrals, and increased costs. We believe that several steps can be taken to improve access to arbitration without overturning this needed requirement. Thank you.
Thank you, Dr. Lenz. All right, thank you. So I'd like to ask all the other people who are going to testify if they could keep their testimony to 5 minutes for the rest of you, and to submit as much as you want in writing. All of it's going to be included in a committee report and for all the senators, and it will also be posted on my website for access for the public. So Dr. Berg, you may begin.
Okay. Thank you, Senator Lahi, Senator Taitigui, and Senator Kelly Marsh. Thank you very much for allowing us to come here today. I'm coming to you here as your neighbor, as someone else who calls Guam home and has done so for more than 25 years. I raised my kids here. My kids get health care here. I trust the doctors that I send my kids to. I trust the doctors who take care of me and my wife. And part of that is that, part of the reason I trust them is that over the last 25 years, things have gotten a lot better here. We have very good quality health care here. And I firmly believe that my kids are safe when I get up in the morning, and they'll be taken care of if something goes wrong medically. But like many of you this morning, I woke up and I read in the paper that we're a terrible group of physicians here. They were horrible. I think the word horrible was in there. We're a horrible healthcare community here. And I think we know that that's not true. We know that empirically it's not true. And so then why are we here if we aren't a terrible community? Well, I think you have to go back and look at what we learn in medical school, probably learn it in nursing school, and if you're going to become a trained psychologist, most certainly you learn. There is actually a need for healthcare providers to understand what causes stress in life. And so we learn, and there's a list, and it's typically 100 things on that list. What are the things that cause stress? And on that list are the typical things you're going to look at, things like divorce, marriage, having children. Then you have to learn things like it's not just losing a job, it's promotions, right? Having a child is a very stressful event. And that list of 100 items is very variable. Where does divorce sit versus moving, right? Where do those things sit? One list might be number 32, and next one is going to be number 16. Depends on who made those lists, right? But it's typically a list of 100, varies from school to school. But there's one thing that sits at number 1. It doesn't change. There's only one item that never changes on that list. It never moves. It's the very top of that list every single time. It's the death of a child. It's the worst and most horrific thing that can happen to any human being, period. Right? I get choked up thinking about it. Right? I got 4 kids. And somebody said to me the other day, I can't even think about that. I've got a 5-year-old. Don't talk about it. And I said, that I got 2 25-year-olds, I can't think about it. And I have younger kids too. It's horrible. And to say I can imagine how someone feels, that's not true. It's so painful that we can't even imagine it, right? So that has come out as that event took place here, and we are all extraordinarily sympathetic. There's no baby killer here. There's no one here who's sitting and saying, I don't care. We all care. It's a natural human emotion. We all went into healthcare because we wanted to help people, to prevent those things. In fact, if you ask someone coming into medical school, the number one choice they want is to be pediatricians to help kids. Now, we don't always stay in that, but it's incredible that people do and take care of kids knowing that sometimes things don't go right. So if it's not true, then what is true? If we're not all bad, if the healthcare community is not filled with horrible people, what is true? Well, I think it is, if you stop and you think about it, is there anyone in here really who's lived with me here on this island that I call home? I go home every day at 5 o'clock. This is where I live. Has healthcare gotten better over the last 25 years here? I don't think there's a single person who can honestly say it has not gotten better, remarkably so. When I moved here, there's no CAT scan. Now we have 5 MRIs. 5 MRIs here. So access to high quality health care, that has completely and utterly changed over the last 25 years. And you might even say, what about over the last 20, 15, 10? Doesn't matter. We all know it's getting better and better. I remember a time when they were having trouble getting air traffic controllers to come out here. Maybe people remember 20 years ago. And the reason they didn't want to come, because they didn't have access to good health care for their families. No one says that now. I don't want to move to Guam because of the horrible health care that they have there. We don't have a problem doing that. We have good quality health care. Perfect? No. But for an isolated island community, yes. We have incredibly good health care here. And I like to think that that is because this healthcare community wants it that way. We want better health care for you, for all of us, for my kids, right? So we have self-governed ourselves. And the Guam Board of Medical Examiners, which has been accused of being extraordinarily unethical, is not such a body. Instead, that is a body that is made up of 7 individuals who put themselves to a certain extent in the firing line because we need to judge our colleagues. But that's what we're supposed to do. And they weren't randomly picked by one person. They may be appointed by the governor, but they are confirmed here. So you've had a chance to look at them and decide, are these ethical people who will take that oath to protect the public? And all of the ones you've put in all take that very seriously. And not everybody has been approved over the last 25 years. So it's people that you think will go in and do that job of investigating, of looking to see other people that we want to bring in. We don't want to bring in terrible people here. You've been told in all sorts of press releases and the like that the standards are incredibly low. Let's talk about reality. When you go to look at the standards as they're set nationally in each state, you can go to California, you finish high school 4 years, finish medical school 4 years, and then, high school 4 years, medical school, college 4 years, medical school 4 years, and then you have to do an additional year of training in California before they'll give you a license. In Pennsylvania, you have to do 2 additional years of training before you'll give you a license. In Michigan, 3. In Guam, 3 years of progressive postgraduate medical education. It's among the most stringent requirements that exist. And routinely, we don't give people their licenses because they don't meet even our educational requirements. It basically means you have to have trained to be a specialist. You can't do one internship here, one internship over there. You can in Pennsylvania, you can't here. You can't do an internship in surgery, a year of psychiatry, a year of dermatology. You can get a license in Michigan, because that's 3 years of postgraduate education. On Guam, it has to be progressive. You have to continuously go up that chain. So no, we have an incredibly restrictive and high bar to cross before you can get a license here. And when you sit on that, so we're there preventing people from coming in here who we don't think want to be part of that continuous improvement in care here. People who want to come here, call it home, and make it a better place. That happened to me when you say we have a terrible community. When I first got here, and people like Chris Perez, Larry Lizama, John Titano, these are really good doctors who came and said to me, please stay here when you get out of the military, join us in making this a better place. I loved Guam. I think about Chris, was a good friend of mine and was an incredibly good person. God rest his soul. And he helped to keep people here who wanted to make Guam a better place to live, and it's worked. So if you look at the Guam Board of Medical Examiners, who has done an incredibly good job of keeping out people that we didn't want to come here, who didn't want to make this a better place to live, it's not just us. It's not just this group of doctors sitting in a quiet room with some white coat shield. You have a member of the public that you confirmed here who sits there and is our vice chair. He's not interested in protecting doctors. He, like the rest of us, wants to protect the public. That's what his job is. He, like the head of the Health Professional Licensing Organization, Xenia Pasina, she is a member of the public who sits there and watches us and makes sure that we're doing the right thing. It's okay, we don't mind that. We have a member of the Attorney General's office who sits there and makes sure that we do the right thing also. That's okay. Those checks and balances should be in there. We like to believe we do it anyway. But it's nice to know, as someday I won't be on there, that there are people watching out to make sure there isn't a white coat of silence, that those investigations are done thoroughly. There's also one other governing organization, which you may not be aware of, called the Federation of State Medical Boards, that says if you want to be part of our licensing process of all the states and territories, you'd better do things in a way that meets national standards. And they come and visit us, and they require us to go to their meetings, which Xenia and I just got back from, which is a governing organization that knows what's being done in every state. And they send people out here to look at us and examine and make sure we're doing the right thing. And we have to go through ethics training ourselves here, which was just last week, as a matter of fact. So we have to go and do that ourselves. And I think that the proof is in the pudding, in that for 25 years that I've been here, I can't tell you before that, I can tell you in 25 years, things have progressively gotten better. Better, better, better. It's better now than it was last year. It keeps getting better because we are a good self-governing organization. You can use arbitration, it's there. But I think the reason we're here is because of an extraordinarily tragic event. But that should not derail the continuous improvement in healthcare that we have seen working with the current system. It works. And that one event should not change the incredible healthcare growth that we've seen that makes us a better island, so that air traffic controllers will continue to come out now because they know it's good quality healthcare.
Thank you, Dr.
Thank you for your time.
Doctor, please state your name for the record. And I'd like to acknowledge the presence of our speaker, Tina Munoz-Barnes. Thank you, speaker. Please proceed. And
Hi, my name is Thomas Matula, and I'm a nurse anesthetist. I just want to give a little bit of my background. I lived here 26 years ago, and when I came here, I had an immediate connection with Guam. And even after I left in 1997, I knew I'd make my way back here. And it's special to me because my daughters went to local schools. My wife went to University of Guam Nursing School. It was when they got their first accreditation. And, but it was really the community that I fell in love with and the people. And back then, 26 years ago, it was a different place with medical access. And I came back in 2014, and I was just amazed on how everything has grown here. And, just talking, like what Dr. Berg said, we've made tremendously great strides. And in my field in anesthesia, I've been in the medical field 26 years, but 19 of those years have been in the field of anesthesia. There was a time in my profession we were a high liability practice. It was a very dangerous profession, 40, 50 years ago. Much has changed since that time. So my job is to keep people safe, and that's what I tell all my patients. One of the things I love about this community in Guam is, and I say this over and over, and I've worked in many facilities. I've worked in major trauma centers, I've worked in combat situations, I've worked in large institutions, teaching institutions, small hospitals, medium-sized hospitals. I've been in private practice for 11 years as an independent provider. And out of all my experiences, Guam has an amazing patient population. Their personality is just some of the kindest, gentle, most loving people I've ever worked with. And it's this kind of environment that makes me proud to be here. And many of my colleagues that I work with, they're somehow interrelated to many of our patients. We have family members here that attend local schools, go to churches, and participate in the local activities, and it's just the amount of accountability and responsibility I have to this community is more profound than I've ever felt for any community I've ever lived in. Having said that, I just want to talk a little bit about eroding the arbitration rule can really have a lot of negative impacts on this great community we have here. And I also want to state that, I served 5 years in anesthesia in the United States Navy. And since when I retired, for the last 14 years, I've been in civilian practice. But even, the premise of like a highly litigious medical environments, will make medical healthcare providers practice more safely because of financial consequences is a false premise. When I was in the medical field, I was afforded basically untouched medical liability. I could not be sued. The government could be. Now, having said that, it did not change any way I practiced. Adding a penalty, on making a mistake, doesn't change the way I practice. When I came out to the civilian world, I had to carry my own medical liability practice. And I still was that same driven person with the underlying intrinsic value of, driving me to do the best possible practice, regardless of a fear of liability hanging over my head. But having said that, I just want to say, there are some really detrimental community impacts with, if you erode this arbitration issue. And, I've worked in very highly litigious states before, and I've seen out-of-control lawsuits and the negative impacts it's had on patients and medical providers. And again, as mentioned before, it produces very costly defensive medical practice, which drives up the cost for everybody. Defensive medicine is time-wasting and truly costly. Often unnecessary labs, consults, and more costly diagnostic procedures are ordered against statistical reasoning just to mitigate a fear of a lawsuit. And this is just bad all the way around. So, this type of environment also leads to medical providers to burdensome stress, refusal of medically complicated patients, and ultimate medical provider burnout. The results of the provider is a departure to move on to more work-friendly environments in possible sooner retirement and career change. Guam is a special place, and I wanted my accountability to my medical colleagues, my accountability to the community will never fail. And on top of that, I also have, in a sense, I don't want any rogue providers coming in here and disrupting everything we have accomplished. And so I have a responsibility to keep my medical colleagues, that we're all connected to this community and that we all are driven to the same, accountability to do the right things and deliver safe medical practice. But I think if you erode this arbitration rule, it's going to have a lot of untoward effects, and it's going to dismantle all the progress Guam has made and I have seen in the last 26 years. Thank you for your time.
Thank you very much, Mr. Matula. Please state your name and you may proceed.
Good evening, Madam Chair, Speaker, Senators. Thank you for allowing me to share my perspective as a young doctor on Guam. I'm Dr. Pichi May Piana. I'm a board-certified radiologist at Guam Radiology Consultants.
Could you just repeat it again one more time? Yeah.
I'm Dr. Pichi May Piana, and I'm a board-certified radiologist. My radiology practice primarily focuses on women's imaging with screening and diagnosis of breast cancer, as well as musculoskeletal radiology. Although I was born in the Philippines, my family moved to Guam when I was 12 years old in search for a better life. Since then, Guam has been my home. During my 15 years of education and training away from my family, I always looked forward to the time that I can return home to be able to give back to the community that has embraced my family all these years. And this past August marks my 1 year of service as an attending physician here on Guam. We're all here today to discuss a very important issue, Guam's Arbitration Act. I was present during the last hearing, and I deeply sympathize with the patients who have had bad outcomes in their care. To those who have lost loved ones, please accept my sincerest condolences to you and your family. I believe it is important to evaluate the fairness of Guam's Arbitration Act for both patients and doctors, with the ultimate goal of improving patient safety and quality of care on island. It's important for patients to have appropriate recourse when gross negligence is committed by a doctor. At the same time, I humbly ask the legislature to be wary in advancing policies that would promote meritless lawsuits, as such policies will have severely negative effects in the quality of care that our community will ultimately receive. There are two major points that I hope you will consider when crafting policies for medical malpractice. First is the cost of defensive medicine, and second is the issue of access to care. First, I would like to discuss the cost of defensive medicine. One of the reasons that I was motivated to practice medicine in Guam is the relatively friendly environment where doctors can practice without worry of unnecessary and meritless lawsuits. There is a general public misconception that the arbitration law allows physicians to be lackadaisical or lazy in our medical management, and as a result, have become apathetic and that we just do whatever we want. Some have argued that if doctors were afraid of being sued, then as a physician, I would be pressured to order every study possible to diagnose a patient. I would argue that this type of medicine, defensive medicine, is severely harmful rather than beneficial to patients. Let us be clear with what defensive medicine truly means. It means that in order to protect ourselves from medical malpractice, doctors order tests and procedures that are not medically necessary, pushing up cost of every hospital and clinic visit, and possibly performing invasive and risky procedures that patients just do not need. Doctors will be occupied by ordering numerous unnecessary tests due to the fear of a lawsuit, rather than focusing their attention on providing care consistent with the standards of care that our profession and the standards of care set by our profession and our specialties. This would be a serious problem. Medical decisions would be motivated more by legal questions rather than by what our patients truly need. If doctors order every test known to man, it may reduce the likelihood that we will get sued, but it is not the best medicine for people. It is certainly not the type of medical care I would want for my family, for myself, or my patients. And it is definitely not the most cost-efficient care. In the end, the cost of healthcare would rise, placing undue financial burden on our patients, as well as both private and public medical insurances. We struggle to find healthcare funds for Guam Memorial Hospital now. The cost of defensive medicine as a result of preventing lawsuits would further cripple the hospital. Secondly, let us touch upon how a litigious environment where people are very quick to sue would affect access to care. Access to medical care is already a problem in Guam, with limited number of specialties. As of August 2019, according to the GBME website, there are 534 doctors who are licensed on island. However, not all of these doctors are actively practicing as full-time doctors in Guam. Many of them have already left the island or just occasionally visit as locums or per diem doctors. Our best guess is that there are only about 200 to 300 doctors working full-time and living on Guam to provide care for a population of 160,000 people. Equally important is that currently we lack full-time access to very important specialties, including cardiothoracic surgery, pediatric cardiology, vascular surgery, rheumatology, and dermatology, to name a few. As a result of limited specialty services and resources, the physicians that we have on Guam often have to stretch their capabilities in order to help a patient, because the alternative would be to do nothing, letting the patient suffer and in some cases die, and this is just not acceptable. Now let us imagine how the current situation can be worsened by policies that can promote a highly litigious environment. The inevitable result of a litigious environment is a rise in liability insurance premium. In this scenario, doctors may not have an option but to protect themselves by restricting their practice, including eliminating high-risk procedures prone to complications, avoiding patients who have complex medical problems, or patients who are perceived to be litigious. Or worse, we may just see a mass exodus of doctors leaving the island, similar to what was seen in states like New Jersey, where many OB-gynecologists left during the medical malpractice crisis that they have experienced in the past. Another important issue is physician recruitment. Due to Guam's isolated location from the mainland, it's extremely challenging to recruit doctors, particularly those who do not have a family connection to the island. A litigious environment would make recruitment nearly impossible. Why should doctors move to Guam, where many other states have a friendlier environment to practice medicine? As of 2016, 33 states have imposed caps on damages sustained in medical malpractice lawsuits, including places like Hawaii, Texas, and California. For example, the cap for non-economic damages is $375,000 in Hawaii, $250,000 in Texas, and $250,000 in California. Currently, right now, in the private practice world in Guam, we do not have any caps to non-economic damages. Even our sister island, the CNMI, have imposed a $300,000 cap for non-economic damages. While majority of the United States is moving forward with tort reform to prevent abuse of medical malpractice lawsuits, we are moving backwards by considering to abolish the Arbitration Act. Lastly, if Guam becomes an extremely litigious community, we will more likely have less homegrown doctors. There are currently very little financial incentives to entice homegrown physicians to come back to Guam. The financial compensation for doctors in Guam is typically lower than other rural communities in the mainland. As medical students, there are no special loan repayment programs available to entice homegrown doctors to come back home. There is at least the ProTech Award, which is helpful, but it has limited funding. On top of this, we often have to pay higher tuition for medical school even if we choose to attend a more cost-efficient public school in the mainland, as we are subjected to out-of-state tuition rates. A young physician typically shoulders a large amount of medical student loans after graduation, with the national average upwards of $200,000. Our decision to come home is primarily motivated by our sincere desire to practice at home with our families in our community. I'm sorry. Guam is already a challenging place to practice medicine given our limited medical resources. If we were to criminalize the practice of medicine and meritless lawsuits abound, then the more physicians would really have to consider before choosing to practice on Guam. Please know that those of us who practice here choose to do so, and we make this choice because of our deep love for this community. Patient safety and the quality of healthcare is important to us all. To say that doctors in Guam are not held accountable is simply untrue. If a doctor truly committed gross negligence, there are pathways that are currently available to investigate these cases and hold such doctors accountable. Not only are we held accountable by our patients and by legal liability through the law, but we also answer to both the Guam Board of Medical Examiners as well as to our national specialty boards, where our license can be revoked and we would not be able to practice medicine anywhere. Let me conclude to say that there is no doctor who enters this profession with the intent to do harm. On the contrary, we dedicate our lives and sacrifice many things in our lives in order to provide the highest level of care to all our patients. If the goal is to improve patient safety and enhance the quality of healthcare in our island, then I would urge each and every senator here today to consider policies that would help recruit and retain physicians on Guam, rather than write laws that would worsen the physician shortage that we are already experiencing. Thank you for your time.
Thank you, Dr. Piana. Please state your name for the record and proceed.
Thank you. Erica Masuda Alford. Senators, thank you for your time in allowing us to testify tonight. My name is Erica Masuda Alford. I was born at Guam Memorial Hospital, the current one, and raised in Guam. I graduated from high school just across the street. I remember playing at the Plaza de España, my cathedral grade school PE classes. This is home for me. I left the island to attend university, medical school, and complete my residency and fellowship trainings. I knew I always wanted to be a doctor. I also knew that I always wanted to come home. This is home. Every academic decision I made while I was gone was made knowing that I was coming home. Every big decision. I made the decision to become an endocrinologist, knowing the devastating effects of diabetes in Guam, and my desire to prevent all these diabetes complications. Coming home after being trained in a very large academic institution It was an interesting experience, to say the least. It felt like practicing third world medicine in a first world country. Why do I say that? We lack so many resources. We don't have many of the specialties that are available in the United States. We also lack a lot of the technology and medical equipment that is available in the United States. And when the technology is available, it is often not beyond the affordable means of our patients, or the insurance does not cover it. However, in the last 8 years that I've been home, I have seen tremendous growth and tremendous improvement in Guam medical care. We are seeing improvements on a yearly basis. We have more physicians who have returned home. Just in the last 8 years, we have transitioned to a hospitalist service. We have had so many physicians from here who work as hospitalists, and I see great improvement in inpatient care at GMH. We also have had many physicians return home and subspecializing. We have pulmonology, otolaryngology, gastroenterology. We have surgeons, family practitioners, sports medicine specialists, pediatricians, ophthalmologists, and gynecologists, all who have returned home. Medicine in Guam is improving. However, it is still a far cry from what you would find at any major U.S. city. In Guam, we are often called on to help at the edges of our comfort zone, or sometimes even beyond our comfort zone. I'm a trained, board-certified adult endocrinologist. However, there is no pediatric endocrinologist in Guam. We had a pretty awesome one in Manila, but I was told that a couple months ago she moved to California, so we don't even have that anymore. Children would have to travel to the States every 6 weeks to 3 months just to see their endocrinologist. That is often not feasible for the vast majority of families on the island. So for the conditions that I am comfortable with, I just take care of the kids. For the conditions that I'm not very comfortable with, I have them fly to see a pediatric endocrinologist, get all their recommendations, and follow their recommendations so that it minimizes the amount of travel that they have to do. When children get admitted to Guam Memorial Hospital in diabetic ketoacidosis or diabetic coma, the pediatricians often call me to help them manage the children. The children would never survive a plane trip all the way to California just so that they can be admitted with the help of a pediatric endocrinologist. I realize I am not a pediatric endocrinologist. I'm an adult one. But I do what I can to help these children, and every single one of them have walked out the doors of Guam Memorial Hospital. Guam is a resilient island. We've learned how to deal with things that come our way. Most patients understand that we do what we can with the limited resources that we have. We can't save every patient. We can't heal every illness. Don't get me wrong, we try our best, but we are still human beings. If Guam becomes a more litigious society, we may lose physicians that are here and those that have returned home. It would also make it impossible for me to care for some of my sickest patients. For example, my diabetic patients. Most of the patients who come to me with diabetes have had multiple complications. Their physicians, their primary care physicians, have tried every medication that they know, and once they've almost given up or they're beyond their comfort zone, they send them to me. A lot of my patients, well, I shouldn't say a lot. I have a handful of patients who don't like to take their medications, don't like to follow instructions. These are still patients who are someone's mother, father, sister, brother. They need care, and I care for them. I would not feel comfortable taking care of the sickest patients if I have to worry about the next lawsuit. Or my sickest thyroid cancer patients who have metastatic disease. Well, what if something happens? What if it goes somewhere I don't want it to? I don't always have access to the newest technology or medications for the most advanced cases. I wouldn't be comfortable seeing these patients if I have to worry about the next lawsuit. I also worry about not just the severe cases, but the simple everyday things when we have to practice defensive medicine. For example, among my thyroid patients, "Doc, I'm choking." It's a common complaint. My pills aren't going down. Most of the time, choking is due to postnasal drip or acid reflux. So I talk to my patients, try to figure out which one it is, and treat it. If that doesn't work, I try the other and see if it gets better. I tell them, call me. Call me if you need me. Call me if things don't get better. And if things don't get better, then I go to more invasive testing. But if I have to worry about every lawsuit and practice defensive medicine, that same patient, instead of me saying, okay, I think it's just this, let's give it a try for a couple weeks, I would probably go immediately to sending them to an ear, nose, and throat for a laryngoscope, a gastroenterologist for an EGD, and maybe even a barium swallow. What does this subject the patient to? Extra radiation, anesthesia, and invasive procedures that really could have been avoided. In a similar fashion, any abdominal pain would elicit a CT scan of the abdomen, again, more radiation. Any chest pain. So if you walk into an emergency room in Connecticut where I did my residency, you would immediately get a CT scan, a chest x-ray, about 20 tubes of blood, even though it was just a simple viral infection. And this happens all over the US. And here's the other problem. What if the patients can't afford their copays and their deductibles? This happens more than you can possibly imagine. What happens then? My patients who actually need the procedure for a known diagnosis, who need follow-up and surveillance, a lot of them can't afford their deductibles and their copays. Well, if every patient who comes in with a little belly pain because of a urinary tract infection gets a CT scan ordered, what's going to happen to our society? I have always wanted to return to Guam and care for the people of Guam. It's not always easy. Our families make sacrifices so that we can be physicians. It's not easy. The other day, my 4-year-old said, and I felt so guilty about it, "Mommy, it's always work, 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 work. I never get to see you. I miss you." That's all she wanted was time with me. My husband has sacrificed his career so that I can come home. It's not fair to him, but he does it anyway. We can't even have dinners for the family. And I know I've seen this with many of my other physician colleagues. You're eating dinner with your family, your phone goes off, you have to run to the hospital. We can't even take vacations without our phones going off. We try to, but the phones go off, and what are we supposed to do? Our patients need us. My family understands that sacrifices need to be made so that I can do what I need to do, so that I can take care of sick patients. My husband always says, "Baby, mommy has to go take care of someone sick, so mommy will be right home." And then she ends up going to bed without seeing me. Every time I've thought to leave Guam to go to the States, that thought goes away quickly, because this is home. But lately, hearing all of this, all the rhetoric about physicians being evil, uncaring people, has made me seriously consider moving back to the US. I've also heard many comments about doctors being on Guam because no one else wants us. I beg to differ. I've gotten many job offers at prestigious academic hospitals to become a physician, a professor there. I know other physicians who have even turned down a Stanford professorship just so that they could come home to serve their people. We do not become doctors to hurt people. We worked hard to get through our training so that we can help people. We cry with our patients and their families when they receive a bad diagnosis or become sick. I cannot count the number of times I've driven home from GMH, tearing so badly I couldn't see the road and having to pull over. We celebrate with our patients when they do well, when they get results, when things improve. We want to work with our patients to keep them as healthy as possible. So, senators, when you contemplate changes that are needed, please consider the big picture. We have a hard enough time recruiting physicians to come to Guam for the locals to return home as physicians. We do not want to discourage people from coming home. We want to encourage our physicians to stay we do not want to encourage them to leave. Healthcare is improving in Guam. Let's make sure it continues to improve. Thank you.
Thank you, Dr. Alford. Please state your name for the record and proceed.
Amanda Del Rosario. Good evening, Senators. Thanks for having me here today. My name is Dr. Amanda Del Rosario, and I'm a board-certified pediatrician at American Medical Center. I'm also a part-time pediatric hospitalist at Guam Memorial Hospital. I see pediatric patients both in the clinic and hospital setting, and I've been practicing here in Guam for the past 4 years. I'm a homegrown physician. I was raised on this island, and I've always considered Guam my home. From the moment I left off-island for college and decided I wanted to become a doctor, there was no doubt in my mind that I would return back to Guam to practice medicine. In fact, the very reason I was inspired to become a physician was because I grew up here seeing firsthand how much of a need there was, and still is, for more doctors on our island. So after completing my medical training in the States, I came back to Guam because I was ready and committed to provide care to our island's children, knowing fully well that I'd be facing many challenges doing so in a resource-limited setting. I also recruited my husband, Dr. Michael a California native and a pediatrician as well, to come back to Guam with me and embark on this career path together. But before I even started seeing babies and children as a pediatrician in Guam, I experienced what it was like to be at Guam Memorial Hospital as the family member of a sick patient. The patient was my father. He first became ill from what appeared to be a simple case of the stomach flu. Excuse me. But after he got hospitalized, his condition got worse, and he couldn't recover. He died at GMH on February 12th, 2015. Sorry. I share the story of my father's passing because I want it to be known that I understand what it is like to unexpectedly lose a loved one at GMH. I truly empathize with every person who has had to deal with the loss of a loved one. That deep pain and that heartache. I also remember obsessing over my father's case, scrutinizing the events that led up to his death, using my medical knowledge to try to see if there was something perhaps that had gone wrong, some sort of mistake that his doctors made. But there wasn't. In my state of immense grief, I wanted to find someone to blame. My father's doctors couldn't save him, but it was not their fault. He died at GMH, and it was no one's fault. As doctors, when our patients get sick and become critically ill, we do everything we can to save them, but sometimes, despite our best efforts, we are unsuccessful. But it doesn't mean we made a mistake, or didn't do a good enough job, or didn't care enough. Although it's the bad outcomes that tend to be highlighted in the news and talked about the most, they're actually few and far between. And what we don't often hear enough about are all the good patient outcomes and the successful recoveries that occur on a daily basis, the lives that we do save in the hospital, thanks to the dedicated efforts of our island's doctors and the improvement in medical care that Guam has experienced over the years. In the relatively short time that I've been back home, I can already attest to the fact that despite our island being medically underserved, the quality of medical care has improved significantly, as you've heard from my colleagues. Although there are still very few pediatric specialists on island, we are fortunate to have adult medicine specialists like Dr. Alford who are willing and able to help care for kids. This saves so many of my patients and their parents from having to deal with the burdens of off-island care. And as for the pediatric patients at GMH who do need to be urgently transferred off-island, we now have the Angels in Need Fund, a charity fund that was established by Dr. To provide financial assistance to patients who can't afford to go off-island. It was only a few years ago when Dr. had a patient at GMH who died while waiting for off-island transfer because his family was still trying to raise funds for travel expenses. I remember how Mike was so outraged by the unfairness of the situation that he worked tirelessly to create the Angels in Need Fund so that now no child will have to die at GMH because of the lack of medical funds. With this type of physician leadership and teamwork amongst primary care physicians and specialists, pediatric care in Guam continues to improve, and I am proud to be part of a collegial and patient-centered work environment. We all work together, help each other out, and we do what we can with what we have to take care of the kids on our island. The current Medical Malpractice Mandatory Arbitration Act allows us to advocate for our patients and provide medical care to the best of our ability despite how limited our resources are. Without the Arbitration Act, I fear that our entire culture of medicine will change and our patients will suffer as a direct consequence. Physicians will be pressured into practicing defensive medicine, as you've heard, in order to protect ourselves from potential lawsuits. From a pediatric standpoint, practicing defensive medicine means that our children will be subjected to unnecessary tests and procedures that are not only costly, but potentially painful, invasive, and even harmful. Common childhood conditions with benign causes will end up getting major diagnostic workups. Imagine every child with a headache getting a CT scan and radiation exposure to their developing brain. Imagine every infant with fever and vomiting getting extensive blood work, a urine catheterization, and a spinal tap done. Perhaps even worse and most frightening of all, imagine every child who needs surgery or other specialty care having to go off-island because adult specialists will no longer see them for fear of being sued. The Angels in Need Fund will be exhausted, more children will die, and pediatric care in Guam will change for the worse. Practicing defensive medicine is not good medicine, and it's not how I want to practice as a pediatrician. I love this island, and I care deeply about our community. My patients are precious to me, and I treat them and their families like my family. I don't regret my decision to come home, and it makes me optimistic to see other homegrown doctors coming back to serve our island as well. I came back home not because I couldn't find a job anywhere else, but because I didn't want to practice medicine anywhere else. Knowing how hard it is to recruit physicians to Guam, I invest my time outside of work into running a nonprofit program that mentors young pre-med students here in Guam and pairs them with local physicians in our community. And I do this because I genuinely believe that by investing in our youth and inspiring them to pursue careers in medicine, they too will one day come home to serve and care for our island's people. But if Guam becomes a hostile work environment where the practice of medicine becomes driven by the threat of lawsuits, we will not only discourage future doctors from coming to Guam, we risk losing our current practicing physicians. So as the Medical Arbitration Act is being reviewed, I ask that we look not only at the current Guam law, but also examine the overall way we view the culture of medicine and the physician-patient relationship. If you have mistrust in the healthcare system and go into a doctor-patient relationship already thinking your doctor is out to profit from you, then everything that doctor does will be viewed with malicious intent. But we became doctors to help people, not hurt them. We sacrificed years of our lives, time away from our families, and chose to dedicate our life's work towards helping others. So I ask that we not change the Medical Arbitration Act, but rather change the way we view our doctors who are trying to do good in the community and provide compassionate, quality care to our island's medically underserved people. Thank you.
Thank you very much, Dr. Del Rosario. We've got other people to testify, but before we switch panels, I'd like to ask the speaker if she has any questions of this panel. Senator Marsh Taitino? Senator Taitigui?
Thank you, Madam Chair. I'd first like to thank you all for being here tonight. And it's hard enough, I know, that you're away from your families as your job requires sometimes, but to have to come here. But it's important that we hear what you have to say. Being that on this, I think this board would be a good, Dr. Berg especially may have an opinion on this as well as yourself for the Medical Society. But my question is, I guess would either the Medical Society or Guam, you know, the two doctors at the end might be able to answer this question, but what is the actual number of doctors on Guam per capita, and how does it compare to other U.S. jurisdictions?
I can answer that perhaps not as specifically as you'd like, but we are currently the only jurisdiction that is considered underserved by the Health and Human Services. We're considered a health professional shortage area, or HPSA. We are designated as an HPSA for every single specialty that exists in medicine. We are currently the only place that has a shortage of every single specialty. So I can't tell you a number-wise per specialty, but the Health and Human Services determines whether you're short or not, and that has to do with certain services that are provided in funding and grants and the like. So I can tell you there's no specialty.
This is per capita?
It's done on a per capita basis, yeah.
Per capita, okay.
Senator, can I answer the question? You know, as primary care, you know, in the average primary care provider per patient, usually about 1,000 to 1,200 per provider. Right now in Guam, even in my practice, you know, you have one provider, you have about 3,000 to 4,000 patients. You know, you can triple the amount of primary care physician on Guam, and we still have a shortage. You know, access to care for primary care is so short that, you know, it's unbelievable. You know, one provider will have 3,000 to 4,000 patients. That's 3-4 times the amount of patients they're supposed to be.
Is this the case in most states?
You know, it's shortage across the United States, but in the territory, you know, we're way behind.
Okay. So my next question is, since Dr. Berg, you're taking this one, is there a standard of care that doctors, they provide to patients on Guam lower than the standard of care that would be provided if you were practicing elsewhere?
I think it's actually a tough question, and I think you've heard here that we're forced, not by someone twisting our arm, but we are forced to step into areas where we are the best choice. So I think the standards are determined by our level of training. So I'm held to the standard of a board-certified radiologist. Dr. Nguyen should be held to the standard of a board-certified family practitioner. But sometimes, as Dr. Alfred said, she does things that in the States someone would say, what are you doing? You're not supposed to be seeing kids. You're not trained to do that. Can she meet the standards of that? She makes the best effort that she can. And would she love to have a pediatric endocrinologist here who says, I'm 100% certain of all the standards? I'm not going to speak for her, but I'll say for myself, in fact, I would like you to speak about that. But I get forced, again, to do things. I don't think you guys, how do I say this? With all due respect, I come home sometimes, and if my son sees me frazzled, if he sees me, if I'm up, Same thing happens every day. I don't know about you, but I get asked every day, are you going to be home tonight, Dad? So when I come home and they see me all frazzled, they know that I have to go in and do things that normally we might not do. We certainly wouldn't do them with the level of training that we have. Over 25 years of experience, sometimes it's every day I go in and talk to them and I say, are you able to go off island? No. Why not? I'll give you 1,000 reasons. Often, I'm taking care of my sick mom and I'm the only one at home. I've got 5 kids, I'm a single mom, I can't afford it. I have immigration issues, I have this, I have that. It's so many issues, they can't leave. And I tell them, I haven't done very, very many of these before. You're probably better off going to some place where you find someone who meets the standard. I don't use that language per se, but that's your answer. And they say, Dr. Berg, just do the best you can. And I do. I do what I can do to help. But am I necessarily at meeting the standards that someone who is trained to do those specific procedures meets? I do the best I can. That's what I can tell you. And so
Thank you so much for that, Dr. Berg.
But it might be worthy of hearing Dr. Alford.
My next question, Dr. Byung, right? Is that how you pronounce your name?
Pianya?
Byung? Thank you, I'm sorry. So if this law was repealed, the mandatory arbitration is repealed, and it follows the same type of tort law or laws that govern the state of Hawaii, and it's something like, let's say that it repeals and then we incorporate that law that Hawaii follows, would you leave Guam?
Oh, to be quite honest, I'm not really familiar with the entire medical malpractice law in Hawaii. I do know that they have that cap set, but I don't know what is their, in terms of, do they go arbitration? Do they have a mediation panel? Do they go straight to litigation? I think I would have to review that to answer your question, but...
Because I heard you talk about Hawaii, and that's why I was asking, because Hawaii is pushing toward a lot of, tort reform, and I thought you might know about it, so that's my question to you.
But of course, to answer your question just in general, I don't think any one of us wanted to come home just to leave.
Right.
Okay. Our goal is to stay here, and we hope that we can continue to work together to make that happen to make practicing medicine satisfactory for physicians and remain safe for patient at the same time.
Okay. Yeah. Well, thank you so much, and Madam Chair, I'd like to request that those who have testimonies that testified, that we can get a copy for us. Thank you so much.
Thank you.
Thank you again. You're welcome to stay. If you have to leave, I understand that. Maybe the two from the two medical organizations can stay also up here on this panel. And I'm going to call, if there are any other physicians here to testify, many of you signed in and but did not indicate that you wanted to give oral testimony. But if you did, please take a seat here. I have... Is there a Dr. Phil Tutnayer? Okay. And then, all right. And is David Weingarten? Please. Attorney Keel, you can have a seat. And Felix, Dr. Cabrera? And it looks like Dr. Blounce is here. Thank you. All right. All right. Please state your name for the record, and you may proceed.
Hi, I'm Dr. David Weingarten. I'm a neurosurgeon in private practice here. Thank you for the opportunity to speak here. A lot of what I had to say tonight was actually already said by most of the other physicians here. You've clearly heard some very passionate speakers who are very proud to be physicians here and have some significant concerns about the possibility of repeal of this bill. I think that Dr. Lentz, in her statement from the Guam Medical Society, addressed the vast majority of my points. And I think one of the most important of those is that I don't think we have to be either a physician advocate or a patient advocate in some sort of mutually exclusive way. There are ways to make arbitration more accessible. I think many of us very strongly believe that patients should have access to an arbitration system and to a remedy if they are harmed. I don't think any of us believe that bad physicians or bad practice should be protected against remedy. But arbitration, I think, is a critical means by which that kind of remedy can be sought in a fair and just fashion. There are certainly numerous examples. Thank you. There are certainly numerous examples of states that have seen significant exodus of physicians when they have repealed some of their tort reform and have seen significant return of physicians when they have induced new tort reform. I know that I believe it was Missouri back in 2002 to 2005 lost about 35% of their neurosurgeons and did not have another influx until they passed new tort reform. Senator Titaway, I'd like to, if I may, address a couple of your questions. When you asked them, I immediately felt strongly about answering some of those questions. I sit on several committees at Guam Memorial Hospital, and your question about whether or not we have less than the mainland standard of care here, I think really strikes home to me. Because one of the things that I'm very proud that we have done in the last couple of years at GMH is I think that we have gone a long way towards substantially improving some of our quality control, substantially improving the things that, for example, the Centers for Medicare Services look for in our quality control. And we have been very diligent about making sure that physicians are held accountable. Dr. Berg told you that there are physicians who have not gotten licensed here because they didn't meet the standards. We have not privileged physicians who did not meet our standards. We have disciplined physicians who had persistent issues. So I think that we have a fairly robust system here for dealing with some of those concerns. But I think some of the physicians who said to you that we do stretch our limits here are absolutely spot on. And one of the things that we have been addressing just recently in some of our committees at GMH is what should we do with physicians, for example, who have not performed a particular procedure for a very long time? What do we do for procedures that are very rare? For a ruptured cerebral aneurysm, for example, the literature shows that if you are at a center that clips less than 50 of those a year, your complication rate will be substantially higher. Now, there are 2 full-time practicing neurosurgeons on this island, and neither of us has clipped more than 2 aneurysms in the last 2 years. So it's just not something that we do very often. It's not something that we see. Should we be allowed to do those things? That's a question we've been asking ourselves. But certainly the complication rate would be substantially higher here because we're not a center that does 50 of those a year. But if someone ruptures a cerebral aneurysm and you don't treat it, they die. And so if I'm the only person, or if I'm away and Dr. Nyame is the only person who can clip that aneurysm, even if we're not a cerebrovascular specialist, even if we're not at a center that does 50 of those a year, we're all you got. And so are we at the standard of care of a cerebrovascular specialty center? Absolutely not. But as Dr. Berg said, we do our best. I'm sorry, if I may.
Yes.
There was one other question that you asked of one of the other physicians. Would she leave if this law were repealed? And I would answer that for myself, if I may. By itself, just with the repeal of the law, I would say, no, that would not make me leave. Fear of malpractice would not make me leave. I completely agree with what Tom Matula said. I don't think that defensive medicine is something I actually practice. I don't think that a change in the malpractice law would change the way that I practice. What would make me leave Guam is if what has happened in some other places where tort reform has been eliminated or in some way substantially decreased, drove up the malpractice rates substantially. I have never been sued, but I would wager that simply because my title is neurosurgeon, I probably pay the highest malpractice rates on this entire island. Yeah, typically obstetrician gynecology, neurosurgery, and cardiothoracic surgery are at the very, very top of that. And even never having been sued, I pay over $60,000 a year, and Guam is considered a fairly low tort area. And so that's why those rates are lower. You look at places like Florida, and some of those rates have been as high as $200,000 a year just for malpractice insurance. And so if the arbitration law is abolished and if no other tort reform takes its place and Guam is seen as a potentially high tort risky area and the malpractice rates go through the roof, that would make me leave, because this is an extremely challenging environment, and I love it. I love practicing here. I started my own business here, but it would be cost prohibitive for me to stay here in this limited resource environment, in an environment where the insurance companies reimburse at a level way below what they do on the mainland, where they deny a tremendous percentage of the procedures that I do. And that's not to criticize the insurance companies either. Their rates are also much lower here. That's just the environment that we're in. But the reimbursement is substantially lower here. And so if my malpractice rates were to double or triple, I do not think it would continue to be worth it to me to practice here.
Thank you, Doctor. Dr. Cabrera?
Good evening. Dr. Felix Tadela Cabrera. Good evening, Chair Terlaje and Speaker Munya Barnes and Senator Taitigui and Senator Marsh Taitano. Thank you for having us tonight. So again, my name is Dr. Felix Tadela Cabrera. I'm a son of Saipan, born and raised. Went to the States and went to school, came back, and actually Guam has been home for about the past 8 years or so. But I really still feel like I serve the entire Mariana Islands, even in my current position right now, which is I'm a board-certified internal medicine physician, and I'm the Chief Medical Officer for Guam Regional Medical City. I'm also the 2020 President-elect for Guam Medical Society. So I want to start by acknowledging that there are a variety of opinions regarding what medical malpractice actually is and what is its intended utility. The same goes for the Mandatory Arbitration Act and what both are ultimately costing us as a society. I personally am no expert on the legal topic, but I know enough to recognize its complexity. To help understand the complexity, at least for me, I will offer two eye-opening statistics which directly conflicts with the sentiment that perpetuates much of society regarding medical malpractice. When discussing a topic that can be quite emotionally charged, it is especially in these situations that we must take pause and seriously look at what the science is telling us and how it helps us balance a human need. But before doing this, it's probably best we start by better understanding what the purpose of the medical malpractice actually is. So upon its inception, medical malpractice lawsuits were not intended, nor were they designed with the goal of punishing healthcare providers that harm patients. Yes, this was never intended to be a form of punishment for punishment's sake. The actual purpose of malpractice lawsuits is to make the patient whole that was harmed, as if the interaction never happened. It is also intended to incentivize providers to take appropriate precautions against avoidable harm. So looking at the actual definition of medical malpractice gives us further insight. It is defined as a breach of duty or deviation from the standard of care leading to harm or injuries to a patient. This does not include poor outcomes or damages alone. Yet all too frequently, those who have poor outcomes believe that it's because of life's unfairness, that it's someone's fault and someone must be at fault. All too frequently, we are quick to assume that if contact occurs with a medical provider in the process, that they must have been in some way, in some manner, derelict of their duty. We can all empathize with this understandable human reaction, especially in a time of grief. I'm sure we can understand that bad things happen as a part of life, and it doesn't always mean someone screwed up. The biggest irony about medical malpractice can be summarized in the following study. Prior to tort reform implemented through most of the country over the past 2 or 3 decades, a landmark retrospective study published by the Harvard Medical Practice Study showed that 1 out of every 15 patients who are actually injured due to medical malpractice ever receive any compensation that will help them become whole. 1 in 15. An astounding 5 out of every 6 lawsuits, which results in some form of payment, mostly a settlement, have absolutely no evidence of actual malpractice. Again, a retrospective study looking back. So let me put these statistics in an analogy that helped me better contextualize this data. So let's say 2 cars collide at a traffic light intersection. A police officer responds to the scene. Now let's say that the police department has a long record where for every 15 red light runners who cause the collision, the police officer only offers 1 traffic ticket, regardless of whether running the red light was an accident or done knowingly. Now let's say in a different scenario, no one ran a red light. There was no collision, of course. There was no breach of duty of the driver, but the accident occurred because one of the vehicle's brakes failed, or a stray dog ran onto the road, or just some unknown reason why the accident occurred. A police officer responds to the scene. He or she sees that one of the passengers has a serious injury. Maybe it's a child. So he or she gives a ticket to the other driver, and that this is known to occur about 5 out of 6 times in this situation. If these 2 scenarios were our actual reality, we would all be outraged by the system, not just those unfairly getting traffic tickets. We would all demand for traffic violation reform. We would all want some means to hold the system accountable and not automatically the individuals. We would demand a process that screens these frivolous traffic citations and throws them out before they can cause more harm. If this scenario was here on Guam and allowed to continue, who would ever want to drive here? Knowing this, who would ever want to move to Guam to work? Who will get a driver's license here? This is the reality of what medical malpractice is without provisions in place like mandatory arbitration or a screening panel. No one gets into a car accident, no one wants to get into a car accident, just like no doctor wants to harm or lose a patient. Yet, physicians have to practice in this environment every day. An environment that rightfully demands quality and safe care, all while being responsible stewards of the limited resources to do so. At times, it seems society has inflated the ability of modern medicine to be able to nearly cure all and save all. At times, we seem to think disability or even death is optional. If that was true, then no one would ever die. A physician's most difficult duty lies in our ability to understand and assess all the risk as best as we can and not be paralyzed by it. If we reject all risk, then the greater good would never be realized, and society will be left with much, much more pain and suffering. You cannot have it both ways. In finding a reasonable balance, safeguards must be in place to ensure that those who are truly harmed by malpractice have the opportunity to be made whole. This is why medical malpractice can actually never be eliminated, and I don't think it should. But this is why myself and many, if not most of my colleagues, support an amendment to the mandatory arbitration that allows actual victims reasonable recourse to become whole in some form. As important as it is to make these patients whole, it's just as important to do so without significant collateral damage of punishing those who are trying to help during an inevitable bad outcome, like trying to clip an aneurysm in somebody who otherwise would have just died, but you gave them a chance, a fighting chance. So that being said, I think it's actually really important that I take a moment to sincerely express my appreciation for Mr. David Lepofsky, for Ms. Annalyn Lagrimas, for their brave testimony during last hearing. I can't imagine how difficult that must have been. In all honesty, as much as I put myself in trying to empathize with them, the reality is that I disagree with many of the statements they made. But that's not the point that's relevant in me saying that, and in what I actually gained from it. Listening intently was incredibly valuable to me as a physician, to try and comprehend their interpretation of what reality is for them, despite the differences in opinions that we may have. I know their hearts are in the right place, and I applaud their effort to try and raise the standard of care for our island. We should all welcome in a responsible way. And standard of care is a legal definition. It's not a medical term that's really used that has anything of significant meaning, because the standard of care changes every day. It changes where you are. And basically it's about reaching to the ceiling of care the best as you can. So on a separate note, as the Chief Medical Officer for GRMC, I would be remiss for not making it known that there are very real and dire repercussions if there was a full repeal to the arbitration law. GRMC is the largest employer and privileger of physicians and mid-level providers in this region. We provide medical malpractice liability insurance for nearly all of our providers under our group plan. Those who aren't, they have their own individual coverage, because you have to have it to practice in our private hospital. So we cannot allow the situation where 5 out of 6 of our good doctors are at risk of having a frivolous lawsuit paid out in their name. All claims settled or awarded are required to be reported to the National Practitioner Data Bank. I estimate that most doctors are significantly more dismayed by the thought of having a hit in their MPDB record than actual financial penalties. I believe this is true because there is no way to be made whole with a frivolous record that could compromise your ability to continue practicing medicine. Lastly, it's worth mentioning that GRMC would never have even come into existence in the first place without the ability to have affordable malpractice insurance. During a past conversation I had with our insurance providers, we discussed the factors that led to our underwriters actually being able to offer us an affordable plan. So in order of importance, this is what was listed. So number 1, that Guam has a history of being a low litigious area compared to the other states. Number 2 was the presence of the Mandatory Arbitration Act. And then number 3 was the volume of physicians in our plan that gave us buying power. If there was a repeal of the mandatory arbitration, you can easily expect insurance premiums to skyrocket, expect the high possibility of good doctors leaving Guam to provide their good care elsewhere. For those of us who remain, expect more pain and suffering. My intention is not to be an alarmist, but to be a realist. It's already hard enough recruiting the talent and skills necessary to substantially elevate the local definition of the standard of care. We've all made significant cracks in this glass ceiling of care for our patients. Please do not let the roof collapse on all of us. So I'll end with a quote by author Simon Sinek. The mind must be convinced, but the heart must be won. I pray that our testimonies tonight have done both. Thank you.
Thank you, Doctor. Mr. Keel?
I've prepared written testimony, which I've submitted, and I will try and...
distribute it, and it will be
Okay.
on our website.
And I will therefore try and abbreviate some of my comments here, since this is already a long evening, and much of what I would have to say has already been said in writing. I would say, though, that Dr. Wen began this proceeding tonight by saying that the purpose here was to present evidence, not empathy and not emotion. My purpose here is to talk about evidence. I've been practicing law here since 1977. I handle medical malpractice claims on behalf of clients, former patients of some doctors here. I would like to just, since we're here to talk about the arbitration statute, I'd like to talk about two experiences, just to give as an example, of cases that I've handled involving the arbitration statute. Case number one, the claimants were a husband and wife who went to a local urgent care clinic. Unbeknownst to them at the time, the husband presented with classic symptoms of a medical condition known as Cauda-Equina syndrome, a spinal condition that required urgent and emergent surgical intervention. His condition was misdiagnosed, and by the time he was able to obtain proper surgical care in the Philippines, he suffered a permanent debilitating neurological condition affecting his groin and lower extremities. A claim was pursued through the American Arbitration Association pursuant to the Mandatory Arbitration Act. The arbitration process took nearly 5 years to complete. The claimant's cost of arbitration alone amounted to $47,186. I've provided a document that shows what those costs were and attached it as Exhibit A. Those costs represent only the claimant's share of the AAA administrative charges. The respondent clinic shared in those administrative charges because the arbitration panel awarded that the costs be split evenly between the parties. In addition to the $47,000 in arbitration costs, the claimants incurred other litigation expenses in the amount of over $66,000. Those costs include travel to investigate and take the depositions of off-island witnesses, deposition transcripts for other witnesses, claimant's expert witness fees, and the payment of the deposition fees of the respondent's expert and other litigation costs. Thus, by the conclusion of that arbitration proceeding, the claimants themselves had to pay over $113,000 out of their own pockets to pursue their remedy. That was because that's what was required by the mandatory arbitration statute. It wasn't a choice that they made to pursue that arbitration. Guam law mandated that they pursue arbitration through the AAA. The arbitration panel that couple had through the AAA consisted of a local Guam attorney, a Guam-based architect, and a doctor from Hawaii. The arbitration trial was held at a Hilton Hotel conference room. The cost of the room rental was split by the parties. The airfare, hotel, and per diem expenses of the Hawaii doctor were split by the parties. At the conclusion of the arbitration proceeding, the claimants were awarded $1,315,822.80. Neither party filed for a trial de novo, and the award was paid. Case number two. The claimant brought a dental malpractice claim against a Guam dentist based upon the failure of 9 dental implants. The claim was initially pursued pursuant to the Mandatory Arbitration Act through the American Arbitration Association, and an arbitration trial was held in 2009. The arbitration panel consisted of a local lawyer, a local doctor, and a local businessman. The panel never reached the merits of the claim since the panel dismissed the case on statute of limitations grounds. In other words, they decided it was not timely filed. The claimant's share of the AAA arbitration administrative fees was $17,806. Despite the potential penalty risk under the Mandatory Arbitration Act of having to pay the dentist's attorney's fees and expert witness fees if he did not improve his position by 40%, the claimant filed for a trial de novo in the Superior Court. The absurdity of that penalty provision in the Arbitration Act is demonstrated by this case. Since claimant received nothing through the arbitration, it was impossible for him to improve his position by 40%. 40% of nothing is still nothing. 4 years later, in 2013, a jury trial was finally held in the Superior Court. Claimant was awarded $62,236. The jury award was actually $113,000, but it was reduced by 45% for his own comparative negligence. I've attached the jury verdict forms to my testimony. The dentist then appealed the case to the Guam Supreme Court, which reversed and remanded the case for a new trial all over again. The case was ultimately settled before a new trial was held. In both of those cases, the claimants had sufficient funds to afford the exorbitant arbitration expenses. In my years of experience, vast majority of potential claimants who come to me for a consultation do not have the resources to afford to go through arbitration. In nearly all potential medical malpractice claims on which I am consulted, once the prospective expenses are described, the claimants choose not to pursue their claim due to the inability to afford those costs. And how many of us can afford $113,000 to pursue a medical malpractice claim? Even if the potential outcome, as in the case number one, could be $1 million or more, they'd still have to have the funds to put up front to be able to pursue that in order to recover that, to be made whole as was described previously. Medical institutions and members of the medical community on Guam are accorded special protection in many ways, not given to other potential defendants in a civil litigation, in a civil negligence case. A case in point is that while the statute of limitations for any negligence claim is 2 years, the statute of limitations on a medical claim against any healthcare institution or professional is 1 year. Also, any claim against any healthcare institution or professional, whether in tort or contract, is required pursuant to the Mandatory Arbitration Act to be pursued through that expensive arbitration process before they're even allowed to go to court. The further penalty provisions embedded in the Arbitration Act provide for a formidable deterrent to seeking post-arbitration relief through the courts. The Mandatory Arbitration Act protects all healthcare professionals and healthcare institutions and their employees or agencies. The healthcare professionals protected by the Mandatory Arbitration Act include doctors, dentists, nurses, physician assistants, nurse practitioners, chiropractors, optometrists, podiatrists, pharmacists, physical therapists, osteopaths, psychologists, acupuncturists, audiologists, speech pathologists, respiratory therapists, nutritionists, clinical dietitians, cosmetologists, and even veterinarians. On the other hand, Guam law that is designed to protect the general public from the potential bad medical practice is ignored and unenforced. A case in point, 10 Guam Code Annotated, part of the Guam Medical Practices Act, requires the medical board to establish and maintain a searchable website that shall contain a wide variety of information about each practitioner, including a listing of any civil judgments or arbitration awards for death or personal injury caused by a physician's negligence, errors, or omissions in practice. No such searchable website exists. Guam's people are given no information that is made readily available to them to make proper and informed decisions as to the competency of the healthcare provider who would be caring for them or their loved ones. I just heard it mentioned that that physicians are required to report any judgments against them to the National Physicians Data Bank. That is not a data bank that is available to the public. I've tried searching it. The public cannot get it. I don't know how you do get it or what is done with that database, but it's not available to the general public on the internet. Notwithstanding the Mandatory Arbitration Act, medical malpractice claims are already inherently expensive to pursue. A significant component of the litigation expense in a medical malpractice case is the retention of the services of expert witnesses to provide evidence in a very elemental part of the claim, that the medical care provided fell below the standard of care. In my experience, experts' fees are quite high, and I guess for good reason, because they've gone through medical school and they've attained the level of expertise. On Guam, the District Court of Guam has ruled that to prevail in a medical malpractice claim, you have to have an expert witness. That expert witness has to provide testimony that to a reasonable degree of medical certainty, the treatment that was provided to that claimant fell below the standard of care. So much of the testimony that's been given here today is about good, honest, hardworking doctors who are doing the best they can. I remember Dr. Del Rosario describing quite emotionally how she had to go through the process of having her father die at GMH. And what did she do afterwards? She searched the records. She did as much as she possibly could to see if something was done wrong, and she didn't find it. If she had found it, I submit what she would have done is consult a lawyer to try and find out what could be done to pursue a claim for the wrongful death of her father. And that is her right, and it should be the right of every individual to pursue a claim to be made whole if there is malpractice. No medical malpractice can proceed unless the claimant has retained the services of a qualified, credentialed expert who will testify under oath that the physician who is being sued, his care and treatment of that patient fell below the standard of care. A legal process known as a Daubert motion exists to challenge the expertise of any expert. A judge can strike the testimony of an expert witness if the expert does not possess the appropriate credentials to render an opinion in the medical issue involved. In any malpractice case against a doctor, another doctor is going to have to testify to a reasonable degree of medical certainty that what the doctor defendant did fell below the standard of care. It is a rare circumstance that you can obtain a medical opinion from a qualified doctor to give that kind of testimony in court. And those cases are the only cases that will proceed. Victims of medical malpractice are oftentimes made uniquely vulnerable by the negligent treatment that they have suffered. They are often subjected to debilitating consequences of the malpractice. They are out of work, financially unstable, and most likely physically compromised. Faced with a one-year statute of limitations, the excessive costs of arbitration and litigation, plus the difficulty of finding an attorney who is willing to handle their case, potential claimants find more often than not that their claims will just go unredressed. They will not be made whole. The Mandatory Arbitration Act exacerbates their circumstances inordinately and, in essence, tends to erode rather than promote corrective justice. A number of things have been mentioned at the prior hearing, such as liability caps. I've given some testimony about what liability caps represent. That's really perhaps out of the context of this hearing here today, but I do urge everyone to watch a documentary film that is available on Amazon Prime, I think, and maybe some other platforms, called Hot Coffee. And of course, by its title, you can tell it's about the famous McDonald's case and how the insurance industry in Guam in the United States, made that case a cause célèbre, and unnecessarily so, because it mischaracterized drastically what happened in that case. The other two issues that that hot coffee documentary address are the election of judges and liability caps. Liability caps, I'll give the one anecdote from that documentary about caps. In that documentary, a woman's teenage son was rendered quadriplegic through the negligence of a third party. He was a teenage boy going to spend the rest of his life quadriplegic, unable to move his arms or legs or anything below his neck. A few years earlier in that state, an initiative had enacted a $250,000 cap on non-economic damages. Non-economic damages are essentially what we call pain and suffering. So the woman's son was only able to collect $250,000 because of that cap for the pain and suffering that he will endure for the remainder of his life being quadriplegic. When the interviewer in that documentary asked the woman if she had voted for that initiative, she said yes, but she thought that that initiative, that cap would only apply to frivolous cases. Caps do not apply to only frivolous cases, they apply to every case. I submit that judges, not caps, are the best remedy to prevent frivolous cases. A case can be dismissed if a judge determines on summary judgment that the claim is frivolous. A cap places the burden on that individual who is injured to protect the entire society from frivolous litigation by limiting their recovery to, in that case, $250,000. In Saipan, it's $350,000. Here we don't have caps. Caps do not prevent negligence, caps just prevent recovery. One of the other points I wanted to raise was that it had been mentioned in the last hearing that the AAA can waive those expenses. They do not waive them. They can defer the filing fee. And the filing fee in case number 1 that I mentioned was $10,200 just to file the case with the AAA. We made a request for a hardship deferral, and they deferred $9,200 of it. They required a $1,000 filing fee. But the claimant still had to pay for all the other administrative costs and the costs of the arbitrators. It's still, in the end, that additional $9,200, they had to pay it. Regardless of the outcome, they'd still be responsible to pay that. In contrast, civil litigants in the Superior Court or the District Court have judges made available to them at no additional cost. These litigants do not have to pay judges an hourly fee for their time for studying their case or deciding their case. They do not have to pay for the use of a courtroom and pay for the judge's airfare, hotel room, or per diem just to hear their case at trial. These expenses are borne by all taxpayers, thus spreading the cost over the population at large. This is how our society is designed to function. The burden of the few circumstances of where there is a bad outcome based upon bad medical care, and it does happen. It doesn't happen, and I can't imagine that it happens from these passionate doctors who have testified here today, but it does happen. And when it does happen, that burden should not be borne by the individual who is injured by that outcome. It should be borne by the society as a whole. And that's how insurance works, and that is not how this Mandatory Arbitration Act works. It puts the burden on the individual claimants to come up with as much as, in case number 1, $46,000 to be able to pursue their claim. I'm going to stop there, and if you had any questions, I'd be happy to answer them, but I appreciate this opportunity to talk with you tonight.
All right, thank you very much, Attorney Keogh. Doctor, would you state your name for the record and please proceed?
Good evening,
Wait,
Senator.
just one sec. Attorney Q, can you turn your mic off?
Sorry.
Thank you.
Good evening, Senators. I'm Dr. Edward Blounce. Thank you for having this hearing late so we could make it in. I am president of the Medical Society. I'm chair of internal medicine at Guam Memorial Hospital, and I'm currently the chief recruiter for Guam Memorial Hospital for physicians. I came to Guam 5.5 years ago. I never thought I would stay here this long. I wanted to travel after finishing my training, and I wound up falling in love with this island. A lot of the people here have become my family, very close friends, and I really enjoy being here. I went into medicine actually because when I was 18, I thought I just had a bad flu, a bad cold, and I just kept feeling worse and worse. Eventually, my mom was able to convince me to go in and see the doctor after over a week of constantly saying, Eddie, go to the doctor, Eddie, go to the doctor. And unfortunately, it turned out I had leukemia. And I wound up having a particularly aggressive type of leukemia and required a bone marrow transplant, and it just wound up being a very complicated case. I got very ill during the process, and it took me a while to get back, but through that process, I got to see how good my doctors were, how my physicians cared about me, and really were in there fighting for me and doing everything they could to make sure I would get through it. And seeing them and seeing how they were, that's what really made me want to become a doctor and want to go into medicine. And a lot of people here on island have similar stories. It may not be a health problem that they had, but it could be a health problem that a family member had or somebody else. A lot of the doctors here really do want to help people to the best of their abilities. A lot of people say that, oh, you're working on Guam because you can't get a job in the mainland. You're working on Guam because you're hiding from something. That's not the case. A lot of the doctors that I work with here, a lot of the doctors that I've recruited, they have other options, and they wind up staying here because they've fallen in love with Guam, just like I have. People have spoken too about what steps are being taken to, I know Dr. Berg with the licensing board, he addressed a lot about the qualifications to get licensed, what happens. As somebody that recruits for the hospital, we look into that too. Anytime that a physician applies to work for me at GMH, we go through, we speak to their previous employers, we check their references, we check the previous states where they're licensed to see if there's any actions against them. And we, GMH, we do check the National Practitioner Data Bank. That is a data bank that it's accessible to all the hospitals and I believe the clinics on island, and the people that work with me and do the recruiting, they will look into the data bank before anybody is hired, before we even, before credentialing is even started or things go to the department. One of the first things that is done is that data bank is accessed. And we don't just access that data bank when a physician is being hired. Every 2 years when the physician is up for reappointment, that data bank is checked again. So the National Practitioner Data Bank is being used, but it's a site for the healthcare professionals and the people hiring them because it's something that should be kept in context. Another thing I'd like to address too is something that a lot of my colleagues have talked about, and that is, the limitations that we're faced with here. As I'm a primary care physician, I'm just general internal medicine, but here on island,
We don't have a liver specialist. We don't have at the hospital a gastroenterologist. And we do the best we can to help these people get through their problems. They could be sent off island, but for a lot of people, being sent off island is either impossible financially or it's a tremendous burden for their family. So we do the best we can to treat certain conditions here that is a little bit out of what we were trained for, but the alternative is the person won't be able to get the care. Another thing too, besides somebody not having the funds or just not wanting to go off island, a lot of times I run into patients that ideally would be best handled off island, and you start talking to them and you find out they don't have a passport. And their insurance company mandates that they get care in the Philippines or in Taiwan, or the Philippines would be cheaper than the mainland. But the problem is they don't have a passport, and it could take several weeks to get that issued. And what are we going to do in the meantime? Are we just going to do nothing and let the patient continue to deteriorate, or are we going to do the best that we can for them, to help them, to care for them here, knowing that we're the best advocate they have? Last thing I'd like to say is I'm from Pennsylvania. That's where I came from before relocating here to Guam. And Pennsylvania was hit with a malpractice crisis several years ago. The hospital that I was born in, the hospital that my sisters were born in, they no longer have a maternity ward. Their OB-GYN service has closed because of the malpractice cost that was associated with it. And it led to other specialties closing up shop too in Pennsylvania, neurosurgery, orthopedic surgery as well. And so I'm not going to tell the senators what to do, but I'm going to say that this decision that you guys come to is going to be a very important decision, and it's going to have ramifications way out into the future. And depending on what happens, I'm hoping that we're just not back here in a few years trying to fix more problems that are created. So thank you for listening to me, and thank you for your time.
Thank you, Dr. Blounce. I think we have, please proceed. Please state your name for the record.
Good evening, Senators. I am Philip Tuttenauer, and I'm a board-certified pediatrist, and I moved to Guam over a year ago. I moved to Guam after working in a successful private practice in New Jersey, and I also worked concurrently at that time for the federal government. OBs have left New Jersey or have limited their scope of practice to just doing gynecology. Physicians have left New Jersey in very high numbers. It is such a stressful place to practice medicine that I have to tell you, Guam has been a breath of fresh air coming from New Jersey and the Northeast. In the short time that I've been here, I've come to realize that Guam is a different, great place. We take care of people like family. When I talk to other healthcare providers in the States, I am often telling them how incredible the quality of care is on this remote island and how much people care for each other. Let's keep it that way. Please allow us to treat our friends, our neighbors, and their family members without additional stresses. Thank you for your consideration and your assistance with this very important matter.
Thank you, Doctor. All right, we have just a couple, all right. Can we just confirm so that you're talking about the same data banks? I think it was Mr. Keogh, Attorney Keogh, and Dr. Blounce, and Dr. Cabrera?
I believe so, yes.
Okay, thank you. All right. Can I go to the next panel? All right, Attorney Keogh, can you stay? And we're going to hear from the next panel.
I'm sorry?
Can you stay?
Yeah.
All right, thank you. All right, okay, so we've got David Lepofsky and Roger Martinez? Okay, so if I could have 2 seats for them, they're going to come up. That's the end of my list. Is there anyone else who was waiting to testify? If you could please check in with my staff. Please come up. Okay, Ms. DeVera. I very much appreciate all of you being here and the testimony and the stories that are coming with it. It's really been an eye-opening night. Thank you. All right, so Mr. Lepofsky, you can begin.
My name is David Lepofsky. Thank you, Senators, for having me back again today. I am the father of Asher Dean Lepofsky, who at age 5 passed away at the Guam Memorial Hospital on October 31st, almost 1 year ago. As stated in the last meeting, I would prefer to be anywhere else besides here, dealing with what I like to refer to as the blatant medical negligence and apathy that took Asher's life, with no accountability or even a public record of what the doctor did or didn't do. Then knowing the same doctor will be able to go off and see and endanger others on Guam, thanks to the Arbitration Act. Isn't it true, doctors, that under the Arbitration Apathy Act, doctors could kill or injure many and we'll never know it, with all the protection it offers to doctors, with the built-in secrecy and privacy included being covered by their colleagues? We heard Dr. Berg say, we're here because of one event, and public policy shouldn't be based on empathy or based on one event. But in fact, we don't know how many events there are. We don't know how many deaths. We don't know how many injuries because the Arbitration Act prevents those from coming to light. It hides it. Then we hear the Arbitration Act being justified or rationalized as a standard of care issues to get doctors to Guam. This meeting is not about the doctors. This meeting is about real people. It's about the victims, about our kids, our family, and out of respect for some of the victims, it's about the death of Asher Dean. It's about the death of baby Faith, Joaquin. It's about the death of Aiden. It's about the death of Charlie. It's about Annalyn Lagrima's father, who we heard about his mistreatment last week at Guam Regional. And the list goes on and on of our injured and dead relatives and friends due to negligence and a legal cover-up with the Arbitration Apathy Act. Look around, please, doctors. Your victims have real faces. To be clear, what we are discussing here does not have to do with all Guam doctors. I want to make that perfectly clear. Guam has some great doctors. I've seen many, including being treated by the same dentist for 25 years. I have 6 kids who have been at one time or the other in the Guam medical system over the last 45 years. Yes, 45 years. Standard of care or standard of treatment for all of them was fine. That is, until Asher entered the Seventh-day Adventist clinic and saw Mr. Shishimiyagi on October 29th. Isn't this what we are talking about really? Not the good doctor, not even the average doctor, but just that doctor who makes negligent mistakes and should be held accountable to protect all of us. All Guam doctors meet the so-called standard of care until they injure or kill somebody negligently. It's not about the ardent standard of care. It's about negligence by a few that the medical community as a whole want to protect in order to maintain their own personal interests. During the last meeting, we heard from Attorney Mitch Thompson and Attorney Bell, who practice on both sides of the aisle with claimants and defendants, both agreeing that the cost of arbitration is extremely high, tens of thousands of dollars, as we heard Attorney Keogh say today, making it near impossible to bring these cases to arbitration and to hold these negligent doctors responsible. Last meeting, I was astonished, really astonished, to hear Dr. Nguyen, acting president of the Guam Medical Association, state that we are confused about arbitration. That was his words. Confused? My gosh. He said this act isn't to protect the doctors. It's about the overall quality of care on Guam, and it helps to bring doctors to the island. I'm wondering if Dr. Nguyen has read the act. If the act is supposed to improve medical care or bring doctors to Guam and the concern is standard of care, why is the arbitration process as secretive as we heard last meeting? The doctors are already on Guam. It has nothing to do with bringing doctors here. Isn't that secrecy part of arbitration to protect the doctor? Not our families, not the community, to hide who did what? Please, name any other investigative hearing or accusation of negligence on Guam that affords such privacy or secrecy. Why do we lose our freedom of speech forcibly when we agree to the forced arbitration? The proceedings prevent us from speaking about the issues. Then, why are we threatened? If we don't like the outcome of arbitration, that again is forced onto us, that we have to pay the doctor's legal fees if we want to go to court. Again, negating due process, a basic constitutional right. Shouldn't we know which doctors to avoid? Really, there's great doctors speaking today. There's great doctors on Guam. I've met many. But wouldn't that be prudent to know which doctors to avoid for improved medical care and choice? Isn't this our right? The whole standard of care that has been mentioned by Dr. Nguyen and others here today, and we've heard over and over again, is made up with no real proof. It's an excuse. Does Dr. Nguyen tell his patients that? Sorry that you are not happy at our clinic, but it's about the Guam standard of care. Or does he take responsibility, or do other doctors take responsibility for patient issues or the many complaints? As I said earlier, I have 5 kids that had good standard of care on Guam, and overall good or even great doctors. Asher didn't. Asher died. Maybe that's a national average. 17% get deadly lousy care. You can't sit here now and tell us that standard of care is not like California, Texas, as Dr. Nguyen did last meeting. It's laughable. It's laughable when you consider that medical errors, negligence in the USA, per recent studies, is the 3rd leading cause of death. Not one study, many studies. According to a recent study by Johns Hopkins, more than 250,000 people in the United States die every year because of medical mistakes, making it the 3rd leading cause of death after heart disease and cancer. Are you saying that our standard of care is worse than the States, as Dr. Nguyen implied last time and as we're hearing today, and that statistically more people on Guam die due to it or would die if we did not have the arbitration law? That's a good question. I'd like to have that answered. Extrapolating the statistical data for Guam based on the studies in the States, it would mean that we have around 107 or more deaths per year due to medical negligence. I bet no one in this room had heard that projection and never will either, as the Arbitration Act prevents these deaths from being reported accurately or covers up the medical negligence that we face and die from. These are studies that have been done over and over, and they can be checked by the intellectuals if they want. If we follow national averages on negligent deaths by doctors, why is it that we have one of the strictest malpractice arbitration policies in the country? It makes sense to me. Shouldn't we try to get rid of some of these bad doctors rather than exposing them to other children or family members? The argument the Arbitration or Apathy Act would bring more doctors to Guam has not been proven here today or in the past. It's just talk. There's no statistics. There's no evidence of that. It's a meritless claim. Attorney Richard Pipes stated in a recent interview, it's a naked finding that there is no crisis in getting doctors, that no such crisis exists. So, who do we listen to? As 100 people per year die from negligence, projected statistically, do we listen to the doctors with the strictest malpractice policy of self-protection in the country, who have arbitration hearings privately that cannot be discussed? Or do we listen to attorneys like Attorney Keogh today or Attorney Pipes, who successfully argued the last malpractice law was unconstitutional? Or what about the national statistics? The state medical malpractice is an epidemic concerns, and we may be losing over 100 people or more per year on Guam to death due to negligence. Again, going back to what Mr. Berg said, we shouldn't base policy on one child. Since it's my child, I agree. We should base policy on statistics and real questions. How many people are injured or killed on Guam yearly? And why don't we know that? Oh, we don't know that because of the arbitration law. Do we listen to the families who have lost loved ones due to careless, lazy, apathetical mistakes? Do we look at the danger that is created by doctors who kill or injure, then practice the next day on the next unsuspecting patient due to the protection of arbitration? Under the umbrella of arbitration, how can you say that you are protecting the people of Guam and want to bring good doctors to Guam and improve standard of care? If this is true, why do you bring doctors to Guam who only meet minimal requirements and some have histories of malpractice already? Some of these doctors may not be able to work in other places. Not all, but some. How can you sit there and justify that? Then you bring these people here, give them protection under arbitration and privacy, and you put us at risk and act as if you're doing us a favor. This does not improve quality of care. This does not improve quality of care on Guam. Isn't it true among some of your community of doctors that some say Guam is known as a place to go to work as a doctor if you can't work in other places? I'm not saying that applies to the doctors here, and I'm not saying it applies to all doctors, but I am saying that there are doctors on Guam who have told me that, literally have told me that. It's a hidden secret. The Guam Medical License Board of Examiners licensed a doctor as an example in the States with more than one malpractice claim against him. God knows why they licensed him. And then they brought him out here where he negligently did the same thing to a Guam patient with serious consequences. We have no idea how many times this has happened, as it's hidden from us. Is this how we are protected by Mr. Nathaniel Berg and the licensing board? Is this how that board and the Medical Association Society propose to improve or maintain medical standards of care? By bringing these people here who hurt or kill us. According to a KUAM interview with Dr. Joan Gill, a Guam Medical Board member, she said, accessing information about your doctor in Guam is not as easy as it is in the States, where most medical licensing boards have websites with information available about doctors, so we can make informed choices. Dr. Gill said the board, the medical licensing board, is hoping to implement the same thing on Guam. That was 8 years ago, but still nothing. Senator Tina Munya Barnes, about 8 years ago also, I believe, sponsored and passed the Patient Protection Through Information Act. This is all about a patient's profile being public information so that we can know who these doctors are, complaints against them. If you go to the pretty much non-functional website of the Guam Board of Medical Examiners, there used to be a dead link for this law. This is another example of how our medical examiners board doesn't protect us. They have not followed this law. This has been a law for 8 years. Have not set up the website and are trying seemingly to hide the bad doctors from us. Just like arbitration, it's all about protecting themselves at the peril of the community, even violating a law. Do we deserve the same standard of information as in the States? Isn't this information a factor of standard of care? Informed medical decisions? Why can't laws be broken to protect doctors, as the medical board seems to be doing? Dr. Gill also spoke about peer reviews. When the board receives complaints about doctors, a peer review is a form of self-regulation by qualified members of a profession within the relevant field. It's not a radiologist reviewing a pediatrician's work, even though a licensing board may think that. Peer reviews, if ever, peer reviews hardly ever happen, if ever. And my son Asher was never afforded what Dr. Gill said should happen, a peer review. Another step in the process that we as consumers should have, another step in the process that we don't, which protects doctors. Again, protection of doctors and apathy is the undercurrent of this, which pretty much again defines the Arbitration Act, along with some arrogance. It's obvious to us, not only as parents, but the community, that the local medical association and society and the Guam Licensing Board of Medical Examiners is about the protection of themselves at the peril of the community. The sad thing about it is there are great doctors on Guam, and I don't understand why they want to protect one or two here and there. The Arbitration Act, or the Apathy Act, is just another tool to silence us. I'm not going to focus on how the act discriminates against all of us, especially the poor. Guam doctors, as what most people think, most of them are great, but they're a protected class that looks down at the rest of us, which is evident in how many of them conduct themselves. Their testimony, not following the patient protection law, and their conflict of interest to cover for each other proves that, not to mention the Arbitration Act. Again, this does not necessarily apply to all doctors, but has become part of the overall physician culture on Guam, in my opinion. James Gillian gave testimony way back when the arbitration law was being enacted. He said doctors used to practice defensive medicine, but they were worried about being sued for malpractice, and that this Arbitration Act would alleviate that, as we've heard today. So they did not have to worry about being sued. Defensive medicine would be one less worry when the act passed. Well, I heard doctors here talking, we don't want to do defensive medicine, we don't want to do this, we don't want to do defensive medicine. Well, defensive medicine means to me that they were doing everything that they could for their patients, lab tests, and etc. Defensive medicine to me means being responsible doctors. Standard of care correlates with defensive medicine, not with arbitration. Baby Faith, 4 days without defensive medicine, had no lab tests that could have saved her life. Asher Dean, without defensive medicine, was left alone in a hospital room for 12 hours. Maybe if they were defensive, they would have been in watching him, not to mention what happened at the SDA clinic. How many have died over the years due to apathetic medical care on Guam as a product of arbitration protection, when apathy became part of our Guam physicians' culture? If the stats are correct, as mentioned earlier, at least 100 have died due to medical negligence since Asher left us. How many is that over the last 30 years since the act has been law? Let me repeat again. Asher Dean, Baby Faith, Joaquin Wacken, Aiden, Charlie, and many, many more. It's not standard of care or even arbitration that killed them. It's a few negligent doctors that did it that should be held accountable. With the Arbitration Act, there are no options for the average person with a valid complaint against a doctor, even though it was referred to earlier that there were. What do we do? Where do we go? Every system of medical care should have a check and balance system with protections for the citizens. That's also a variable of standard of care. I provided information last meeting, on how the Guam Board of Medical Examiners has failed us and is rife with conflict of interest. I didn't say it, but they have been referred to as corrupt in a local recent media report. They do not even allow for or follow the law dealing with the Patient Protection through Information Act. Please, someone ask them why. Also, we have the Guam Board of Allied Health Examiners, who do not act on complaints, even the death of a child. My son Asher's 1-year anniversary of his death is this month, and they received a complaint, and they did nothing. It's been 10 months and counting, nothing done by that board. There's nothing, zero. It's a useless board. I'm asking the doctors here right now, or those doctors on Guam, how many doctors on Guam have a history of claims against them for malpractice, and they were then licensed by the Guam Medical Examiners Licensing Board? How many doctors residing on Guam have complaints against them for malpractice or investigation of complaints for the public to be aware of? What's the secret? Dr. Gill said this is known in other places. Why do we not know it here? Isn't this our right? This right of ours is negated by the Arbitration Act. It's the law under the Patient Protection Through Information Act. I'll be honest with you. You know, you might be hearing a lot of anger in me, and maybe it's coming through in what I'm saying. But in my opinion, as I repeat myself, we have great doctors on Guam. But doctors should be ashamed of themselves with willful disregard and arrogance to lecture to us, telling us we are confused, which we heard last week, talking to us about standard of care, and trying to justify a law that kills us and protects them. Simple as that. We die, no one knows we died or how we died, and next day you're in your office. The self-serving attitude is now public record. The arbitration law is just one example, as I have stated, that show true intent of the medical community to protect their own, not including other laws. It's time to fix things rather than benefiting from this draconian Arbitration Apathy Act. As Attorney Mitch Thompson accurately said during the last meetings, Doctors do not want to judge their colleagues. There is no protection for us, the average person. The Guam Medical Examiners Board and the Allied Board have proven that over and over again. That's some of the testimony we heard here today, trying to justify the act. My opinion is any change in the arbitration law should not include Guam doctors to oversee complaints of other doctors. Per what Attorney Mitch Thompson said, what we have experienced personally and what we have seen and heard here today, they are not impartial and will not protect our interests over their own. I think the crux of medical problems in Guam are issues with care come from the Arbitration Act and attitude of those physicians that try to justify it. I said this before. It's too late for my son, Ashardine. Nothing you can do will benefit him or us. Our suffering will not be alleviated by the repeal of this Apathy Arbitration Act. Nothing. Get nothing out of it. But I can tell you, we will take some solace to know that other families will not suffer as we and others have by making doctors responsible for destroying lives. If there is 107 deaths a year, we should know who they are. You know, Asher was taught the difference between right and wrong. He was taught the difference between right and wrong and to be responsible. Sadly and obviously, his doctors, maybe including some in attendance today, were not. Get rid of bad doctors. Do not bring more to Guam. Improve medical care on Guam. Save lives. Repeal the malpractice arbitration law. It will save lives and it will improve medical care on the island. It's a guarantee. Thank you, Senators.
Mr. Lepofsky, thank you very much again for being here tonight and testifying and submitting your testimony in writing. It's been provided to all the senators and it will be uploaded also on the website. And I want to again extend my condolences to you. I know it must be very difficult. Ms. De Vera?
Good evening. My name is Monica Ann Ninetti de Vera, mother of Charles Vincent Ninetti Blas. Charles passed away at the Guam Regional Medical Center on January 23, 2016. As a mother, seeing your child pass away in front of your eyes is the most painful nightmare any parent should never have to go through, especially when you had placed your trust in the hands of the doctors. On the morning of Friday, January 8th, my son Charles had 3 seizures. The last seizure caused him to fracture 3 areas in his body. He fractured his right scapula, right femur, and his right hip. Not only did he suffer from epilepsy, but he was born with a medical condition called osteogenesis imperfecta, also known as brittle bones. That morning, he was transported to GRMC and was admitted. The operating room at that hospital was closed on weekends, so they scheduled him for surgery on Monday, January 11th. However, it was rescheduled to take place on the 13th at 9:00 a.m. The procedure was supposed to only last 45 minutes. Dr. Arafales, who was the physician that was to do the surgery, said it shouldn't take more than 45 minutes. Since Charles' scapula was only a hairline fracture and the femur had a rod inserted from the Shriners Hospital in Hawaii, he did not need surgery for those 2 fractures. His hips were the only area that the doctor said needed surgery to insert a screw fixation to the hip to help him move. The procedure was cut short and they did not push through with the planned surgery of putting the screws because they discovered that his bones were too brittle. As I waited in the waiting area, 45 minutes went by and there were no signs of the doctor. I get a phone call at 11:30 that morning, and he said that the surgery was canceled because he wasn't able to place the screw and the plate in because the bones were too brittle, that every time he tried to screw the screw in, the bones were too soft. Then he said he would keep him there for a few days, then discharge and recommend him physical therapy when he feels better. I then asked where was my son, and he said he should be out soon. I went to the front desk of the recovery room to inquire where my son was, and the nurse made a phone call to the back, but he was nowhere to be found. The nurse made several phone calls. By the third call, she found him and told me to go up to his room and wait there because they were cleaning him up. That's when the nightmare began. At around 1:30 that afternoon, my son was wheeled up and looked like he was in so much pain. He said, "Mom, can you please ask the doctors for pain meds? Because my hips is really hurting." As I was reaching to touch his forehead, my son was so hot that I ran to the nurse to let her know that he was burning up and that he was asking for pain meds. Sure enough, his fever shot up to 105, and the nurses gave him pain meds and said that she will notify the doctors of his fever. With the room being so cold, my son was shivering, and I wanted to sponge bathe him to try to break his fever because I was afraid he might have another seizure. I even asked the nurse if they could turn off the aircon so I can sponge bathe him, and she said that the AC was only had one control and she cannot turn it off. I took a chance and sponge bathed him as fast as I could to try to break that fever. I had never felt so helpless until that day. From the day of the surgery to the 16th, my son was only given oxycodone and other pain medication to ease his discomfort. In the early morning of the 16th, Charles was given a chest x-ray and a blood culture test for bacteria. That same day, he started the vancomycin antibiotic. The nurse came in and was holding what I thought was an IV bag. I asked her what she was going to give him, and she said it was antibiotics ordered by the doctor. Every time they administered that antibiotic, my son would complain that the medication coming out from that IV line was burning his arms. Every time I brought it to the nurse's attention, they would always say that the antibiotics is very strong and that it's supposed to burn. If I knew at that time that my son was having an allergic reaction to that antibiotic, I would have made a stop. My son was not the average height and weight of men his age because of his osteogenesis imperfecta. His fever took several days to break after the surgery. Even after the fever broke, my son was not his usual self. The doctor decided to discharge him on the evening of Wednesday, January 19th. He was told to be discharged and follow up within a few days to schedule for physical therapy. That evening at around 7:30 p.m., the nurse came in and told me that he was getting discharged that evening. At around 10:30 p.m., a nurse prepared his discharge papers with instructions and a written prescription for pain meds, which I thought was awkward because it was really late in the evening and no pharmacy was open. No actual pain med was to be taken home. I went to the front desk and I asked the nurse, why can't they give him his medication to take home instead of a piece of paper? The pharmacies are all closed at this time. And they replied, "Not sure, Mom. It's the doctor's orders." I then asked why they can't just keep him one more night, since the 4th floor was not even full, so that my son can be given the pain meds at least till the morning. Again, the response, "Sorry, doctor's orders." It was close to midnight already My son was being discharged with a broken hip, femur, scapula, and no pain meds to take home. Imagine that. On January 23rd, which was the Sunday morning that he passed, a Saturday morning that he had passed, I had to make a run to the bank and found my son listening to his music on his phone. I asked him if he wanted to eat before he took his meds, but insisted to wait for my daughter to wake up. So I told him I'll be back. Not even 30 minutes, I get a phone call. As I answered, all I kept hearing was my son in the background screaming, "Please tell Mom to help me. My heart is on fire." I told my daughter to hang up and call 911, and I rushed to the house. Shortly thereafter, the ambulance arrived. My son begged the paramedics from inside my home and en route to JRMC to help him understand why his chest was on fire and pleaded help him make the pain go away. As we arrived in the ER, he told the nurse, "Please help him make the pain go away," repeatedly. When the nurse asked him what his pain was from 1 to 10, he said it was 15. He continued to chant repeatedly, "Please help me, please help me." The nurse left and came back with something in a syringe, and my son asked if that was pain meds, and she said yes. Not even 30 minutes after giving him that shot, my son started vomiting. I don't know how many times I had to empty that vomit container, but he was vomiting blood mixed with a lot of white, thick fluids. He was panicking, and though his hip was fractured, he kept squirming in his bed, and ignored his hip pain, begging the nurses to help him for his chest. I ran outside to get a nurse to call the doctors, and the doctors came in, and they said that he wanted to get a CT scan done on him right away to see if there's anything in his chest that may cause any blood clots. As they were getting him ready for the CT scan, my son grabbed my hands and yelled, "Mom, please don't let me die, Mom." I then told him, "I promise I won't let you die, son." Those were the last words I had with my son, Charles Vince. Not even 5 minutes, I heard code blue CT scan room over the intercom. My mind went blank for a few seconds, and I grabbed my husband and begged him to tell me that it wasn't my son. We waited in the waiting room for over 2 hours before the doctors came out and said, "I'm sorry, we tried to revive your son several times, but no luck." As we were going to see my son in the trauma room, I wished that it was all just a bad dream. But to this day, I still do. I felt helpless seeing and touching his cold body that afternoon, especially since it's been 3 long years and still can't get any honest answers. On the following Monday, January 25th, I get a phone call from JRMC saying that my son's remains will be forwarded to GMH to Dr. Espinola's office because an autopsy needed to be conducted. The autopsy protocol, since my son was a patient at JRMC, was discharged and came back and had passed away there. I inquired with them if I would be able to contact Dr. Espinola myself, and was advised that it was not required and to just wait for the autopsy to be completed. I received a phone call from Island Funeral Home on Thursday, January 28th at 4 o'clock that afternoon, informing me that my son's remains were at the funeral home. I was told that I was able to come down and prepare him for his viewing, which was set for Sunday the 31st. His funeral was set for Monday, the February 1st. As I was getting my son dressed up for his viewing, I inquired with Nancy Aquino, who is the owner of the funeral home, what was the final results of Charlie's autopsy. To my surprise, she told me that there was no autopsy done. I asked her why, and she said Dr. Spinola did not need to do one because he based his decision on what the medical records indicated was his cause of death. It was too late that afternoon to call his office, So the following morning, I called and found out that Dr. Espinola was off island and would not be available till Thursday, February 4th. So I made an appointment to meet with him that morning. During that meeting, I had informed Mr. Espinola that I had some concerns and told him what had happened to my son. He went on to mention that if he knew that I had concerns of my son's passing, he would have returned my son's remains back to GRMC to conduct the autopsy. But he said that he made his decision because GRMC only forwarded Charles's remains with the medical records of the day he had passed, and no other medical records was attached stating that he was hospitalized from January 6th to the 19th. He advised me that it was beyond his control now, and that the only resolve to issue is I take this to court. After I buried my son, I immediately went to GRMC to retrieve my son's medical records. After weeks of reviewing his files, trying to search for answers, I put several puzzles together to see what the actual cause of death was. My son was only admitted for fractures from the 8th to the 19th. Before his surgery, which was on the 13th, all his vital signs were normal and no fever whatsoever. All I could think of was that Dr. Aroflis went in, drilled his hip, hit his bone marrow, closed him back up, and caused him to have sepsis shock. Dr. Ali Insaf was the physician who prescribed the antibiotic, but I guess did not do his homework on the dosages because I sure did. This was what I discovered in the antibiotic pamphlet, that the vancomycin warning toxicity has occurred in patients receiving vancomycin. It has been transient and permanent. It has occurred mostly in patients who have been given excessive doses, which is hypertension. My son's heart rate and blood pressure was so high during the time he was given those antibiotics. The dosages were to be given by the weight of the patient. My son was only 84 pounds. The dosages were 250 milligrams for the first, on the 16th, they administered 4 times. Likewise, on the 17th, 4 times, and 1,000 milligrams 2 times on the 18th and the 19th. I know I'm not a physician, but those are the only explanations that I could think of that would have killed my son, overdose, which has caused his cardiac arrest. On June of 2016, I inquired with an attorney, Sergio Rufo, who was at one point practicing here in Guam, but he had moved to Hawaii. He stated that I had a very good case, but I needed to come up with $60,000 for the arbitration that needed to be filed within 1 year from his death. I was in shock because I had no idea that January 23rd would have been the last time that I would see my son, and did not prepare $60,000 thinking that he would pass away. To this day, I am still in debt with Our Lady of Peace because I had to prepare to bury my son. This meeting is to let all the families who are victims of this medical malpractice mandatory arbitration act speak up and let you see what this law is doing to all of us poor people. Protecting the doctors should not be a priority here. What right do these doctors have to just take our loved one's life and walk away like nothing out of the ordinary happened? This law needs some serious revisions because our loved ones are still not resting in peace. My son to this day visits me, and yes, you will think I'm crazy saying this, but believe me, my son's soul is not at peace because he was murdered while in the trusted hands of those physicians. I gave up at one point because I didn't have that kind of money. And 1 year, and the first year, and 1 year I was getting close. On December of 2016, I was reading the newspaper and saw another patient who was suing GRMC for wrongful death. I was overwhelmed and my depression started to worsen, seeing that So I went searching once again for another attorney. On June 22nd, 2017, I met with attorney Gloria Rudolph, and she took my case. We went to court in April of 2018 in front of Judge Sensen. The judge stated to have my case rescheduled because they wanted to wait for a decision of another similar case being heard by Judge Sicola. When the hearing was over, my attorney advised me to just hang tight and wait. Here I was thinking, oh, I shouldn't bother her because she said to hang tight and wait. However, in January of this year, I was browsing on my computer. For some odd reason, I'm not sure if it was my son giving me signs, but out of nowhere, I just typed my name, and what did I discover? A court document with my name on it. It was a court document filed by JRMC, which stated decision and order granting defendant's motion to dismiss. That was filed and recorded on May 4th, 2018 at 10:23 a.m. I immediately called my attorney's office to see if I was able to meet with her to try to get answers as to why I was never notified of this court hearing and why I was never given a copy. But she wasn't available, so I left messages for her to return my call. I made 10 calls here and there for about a month, but not once did I ever get a return call. Money is not going to bring my son, Charles, Asher Dean, baby Faith, Zachary, Joaquin, Aiden, and anyone else who I missed, who are all victims of this negligence. We just want justice and put a stop to these doctors in thinking that it is okay doing what they are doing. We all have repeatedly, time and time again, heard of this arbitration law, and we are all here today to plead for your help. So we ask this from you to please improve medical care on Guam, yes, work together in saving lives, and let's repeal this malpractice arbitration law. Having to relive this nightmare is very overwhelming for me and my family. Although it's been 3 years and 8 months that I haven't seen my son, I feel that I need to find closure for him. And by doing so, may his soul rest in peace, as well as all the other families who have lost a loved one. Thank you.
Thank you very much, Ms. DeVere. We're very sorry for your loss of Charles Vincent. Condolences, I know. Thank you for coming here today, though. Is Mr. Martinez still here? Or Dr. Berg? All right, or any other member of the Guam Medical Examiners Board? All right. So our final testimony today will be Annalyn Lagrames. Please proceed.
To be honest, I wasn't going to testify out of fear. Speaking like this really puts me and my dad at risk at the first hearing. I didn't expect this to be on the news, for some of the staff at GRMC to be upset with me, even to the point where one of the doctors had personally asked me to be replaced as my dad's attending physician during the following week. Not only that, but incidents of negligence that have never happened before just so happened to occur afterwards. So I also wanted to point out that his medication labels were switched for his wound, and was administered to him on multiple occasions, causing him to cry in agonizing pain. Had I not pointed it out and questioned it last week, they wouldn't have switched it, meaning none of the staff cared to even read the label. Also, the following day, his food orders were ordered pureed, and they mistakenly gave him a solid food tray. Had I not come on time, it would have put my dad in a deadly position. I also have pictures of these incidences. However, you should understand that now how unprotected my dad is with the current law. I have nowhere else to turn to but force myself back to publicly speak now and bring it out to light. They must be really sick of me and my dad by now, to the point that I fear that he might not be in safe hands because of me due to subtle retaliation. If it really isn't by coincidence, and if it helps, I'm sorry I was oblivious to think that you wouldn't find out. I did not intend for my dad's lack of care to be made known island-wide, and I thank you for all the hard work you've done thus far. It's not easy trying to reverse my dad's hospital-acquired bed sore. I just wanted you to know this is nothing against some of the hardworking staff at GRMC. Ironically, I have nothing against the physicians doing the best that they can and missing the signs of something as simple as a stage 1 bed sore. I'm actually against the fact that our hospitals are understaffed. Nurses understaffed, CNAs understaffed. In recent news, GRMC, under new management, had laid off about 40 staff. Not only that, but I also heard that among those 40 staff was the former wound care team that would have addressed my dad's wounds had they not been laid off. And now they're starting a new wound care team, ironically. I'm just trying to save my dad by all means. And if it means bringing this to light, then so be it. I just hope you do not take it against my dad, whose worsening condition already puts him in a completely helpless state. I come here to represent also the now 900 and counting Guam residents who have signed a petition to repeal the triple MA. Is mandatory arbitration fair? All 50 of the US states don't impose forced arbitration on their people, yet only on Guam is our government forcing us to go through arbitration, where chances of a settlement are 0 to none. But we wouldn't know that, really, would we? Records of any malpractice and negligence cases are tossed out the window through forced closed-door arbitration hearings, so that no light is ever really shed on issues brought up. The basic question is, does it serve the people of Guam? The triple MA, no matter how you defend it, really is biased. It's biased because you impose the burden of costs that could go up to hundreds of thousands of dollars on the poor to average citizen on Guam. Not only that, but that money can easily be tossed away through the chances of manipulated private proceedings. I believe in our healthcare system. I believe in our health professionals to trust in your ability and not cower to the court's due process just because of your title. The law carves out a special kind of privilege, somewhat close to immunity, but that isn't fair, is it? We should all be held liable for our actions and work ethic, so that in the end, people will know that you, in fact, did the best you can. But the triple MA makes us doubtful of that. It makes it impossible to really know whether you did your best without open due process. Otherwise, all the doctors testifying here are saying my dad's negligence case is baseless and without merit. Really? It's a hospital-acquired stage 4 bed sore, classified a never event. In the States, it's only allowable arbitration if the doctor gets his patients to sign off on arbitration agreements. And only some doctors actually have the guts to do that, many opting out, reasoning that it makes them look bad to their patients. So what does that really say? Even the best doctors and hospitals in the US have to go through court to defend the work that they do? All I'm asking for is public and open liability because the people of Guam deserve it. It's no question that people on Guam know someone that has complained about a hospital and medical care on island. Take example GMH. How are they even able to operate in such conditions that are easily let go? So really ask yourselves, do you even have the people's trust? And should you impose forced arbitration proceedings on them? The triple MA was imposed 30 years ago. It's outdated. Recruiting doctors through means of protection is questionable. Because when you beat after quantity over quality, quantity shouldn't even be an issue because insurances nowadays offer off-island treatment care. Defending the triple MA is like saying that these physicians and hospitals are 100% perfect. Everything they do is right and shouldn't be questioned in court. That they did their work 100% accurately with no flaws. I say that because arbitration is unrealistic and really biased based on a political system that if lawmakers don't support unfair means of something that is forced and imposed on the people of Guam, then they lose the support of the elite and the HMO and insurance companies. As for the standard of care on Guam, what really lowers the standard of care on Guam is when these issues are not brought to light, like my dad's bed sore. It makes me question, why is it only my dad that got a stage 4 life-threatening hospital-acquired bed sore? Who gets to determine the standard of care? What is it, not the standard of care that my dad's bed sore not preventable? I just wanted to inform you that damage done by the cause of his wound is extremely hard to reverse. And last I heard, the infection has reached the bone. And he is even more at risk of dying after being saved when he was first admitted due to a simple preventable never event that will probably never see its day in court. Knowing that there are national standards in place to prevent it, something as simple as turning the patient every 2 hours and letting the family know the signs of a stage-1 bed sore. I had to find that out through research myself. Was my dad the only one that suffered from negligence like this? But we'll never know because cases like these are barred from entering the court. Is that justice? Is that what you call standard of care? Standard of care is not determined by hiding face, but openly and publicly accepting what went wrong in order to improve. Dr. Cabrera told me that when he spoke with me about my dad. Otherwise, how will we be able to learn from our mistakes? You see, the repeal of the triple MA as something to fear. I see it as a light to bring awareness of the negligence that does happen. Why do you fear? If you in fact know and are confident that everything you do is right and ethical, why not trust the justice system just as you ask the public to trust negligence and malpractice to never happen in the medical system? Thank you.
Thank you very much, Ms. Lagrimas. I hope your dad is doing okay. But there are a couple things, I guess, that we don't have the answers to right now, and that is, I think Mr. Lepofsky, you're right, that the GME does not have online yet some of the things that have been mandated by law, and we will follow up with that. And may I ask the panel, my colleagues, if they have questions? I know it's Speaker Barnes.
Situs Masi, Madam Chair, and I just want to thank everybody for being here tonight. And this is not very easy as we hear the stories from even family out there. But I know that in our efforts as policymakers to be I don't even know if fair is the right word to say. But I want to say that based on the testimony presented tonight and last week or 2 weeks ago, that our laws are old. And we should not be afraid to bring it up to the forefront again and bring all the stakeholders to the same table. In the medical profession, in the boards, in the families, and see what we can do together. I was going to ask Attorney Keel, based on some of the research that our policy staff has done here, one idea that came to mind, and I'm just going to be bold to ask about it. In the state of Massachusetts, physicians and attorneys have expressed support of reducing unnecessary lawsuits and improve patient safety by requiring the claimant to give the provider 182 written notice before any action is commenced, and it would be called like a cooling period, and then after that then the claimant can go into court. And there are a lot of other things that was talked about even with the National Practitioner Database Bank, and how Guam is maybe only 29% compliant. The updates based on both the laws that we as policymakers have passed. I know mine and Vice Speaker Cruz's law was passed in 2011, and then Senator Mary Torres and Senator Jim Espaldon then passed legislation to update a lot of that in the 34th Guam legislature. And based on that policy that's on hand, is there any more recommendations that could be included? And maybe without giving you at least the copy for that, I guess at least my simple one would be that cooling period, based on the presentation you've given to me, given to this body.
Yeah, thank you. I'm not familiar with that approach, but obviously there's serious consideration and emotion on both sides of this issue. And all I'm suggesting is that something has to be done to spread the burden out so that each individual claimant doesn't have to spend $40,000, $50,000, $60,000 to get redress of a grievance. I'm not sure what the answer to that is. A cooling period, I mean, essentially the Government Claims Act has a similar provision, is that you file a claim and the government has 6 months to decide it, to investigate and decide it. That's something worth considering, but I don't think it ultimately addresses the concerns of the medical community, which is that allowing free range as one of the doctors said, open season on doctors. That's not what we're looking at, is open season on doctors. We're looking at being able to have a redress of a legitimate grievance. Insurance rates are probably at the base of the medical community's concern with that. And there may be other alternatives to look at, captive insurance of some kind to provide that protection, but not to put the full burden on the claimants to have to come up with the kind of money that they have to come up with. And a malpractice case is inherently expensive, as I said, because you need an expert. And an expert is a physician who's going to give an opinion that what another physician did was below the standard of care. That's hard to get. To get one doctor to say something against another. You'll never get a doctor here on Guam to give an opinion that another doctor committed malpractice. It's just too small a community, and that's understandable. So it takes going off island to find an expert that you're going to have to pay for to give that opinion. That is required before even any kind of claim can be considered or brought. And then add on top of that the expense of a $40,000 or $50,000 arbitration proceeding. Most people can't afford to do that. So I don't know what the answer to it is yet. I've only just given recent thought to this in presenting testimony here today, but clearly this is something that needs to be addressed. And I wish you the best on trying to figure out the answers for that.
I was also reading the letter talking about one of the cases that was presented, and you talked about the fees that could be deferred, but yet at the ultimate end, they still had to pay, the claimant still had to pay the full fee. And I also wanted to ask, is there any certified arbitration lawyers, I mean, the system in place here on Guam? I know we had to pay for the expert to come here and do the ruling. So are we saying there's no certified arbitration here?
To my knowledge, there is not. I think I mentioned in the testimony, I don't know if Mr. Thompson is still here or not, but PAMS is the Pacific Arbitration something society, I don't know, is owned in part by Mr. Thompson. So as I said, I can't recommend to a client that we use an arbitration procedure that is controlled by the lawyer on the other side of the case. I think my clients would justifiably laugh me out of the office for even recommending it. No, there is no other here. And in fact, as I described in my testimony, the statute actually can be interpreted to say we are required to use the AAA, the American Arbitration Association, because there's none that is certified here for the specific purpose of arbitrating under that statute. But the arbitration alone, by just having to have 3 arbitrators at $300, $400 an hour for them to even review your case, to hear your testimony, to order whether discovery can be done, it's incredibly expensive. Whereas if you can go to court, you get a judge and a courtroom and a jury for the filing fee. And that spreads the expense out over the community, which is what insurance does, is it spreads the cost of risk out over a broad spectrum. Everybody who drives a car on Guam is required to have insurance. There should be a similar spread of risk on medical malpractice, and it does happen. It is exceedingly rare that it happens, that an outcome is a bad outcome caused by negligence. It is exceedingly rare, and the only way to determine whether or not that bad outcome was negligence is to have a certified expert, an appropriate expert, give you an opinion that it was below the standard of care.
Thank you, Attorney Keogh. Madam Chair, as I know that in the efforts, I want to take the time to thank you for continuing to move. We understand that we have one more part that we are going to look at as it relates to policy, and I do know that there are several states out there that sometimes we don't need to reinvent the wheel. We can just look at things and emulate them and bring it to and work it to the standards of what we would need as a community, as a small community. So I'm going to continue to work closely with the Oversight Chair, and I want to take the time to thank her and all of you guys for being here, both the pros and the cons, and it's something that we need to work on really hard, but I want to share that based on the testimonies provided in these two hearings, that several of the ideas that our policy team is looking at could possibly come to the forefront, and I make that commitment to trying to look at what would be good for the majority of all. Thank you.
Thank you, Speaker. Senator Taitigui.
Thank you, Madam Chair, and thank you for the opportunity to go next. I have another appointment, but I really appreciate everyone for being here today. I think it's about a balance, balance on both ends, the patient as well as the doctor. So that's what I'm looking for, and I appreciate, Robert, you being here today. I've read a lot about your work that you've done, and one of the things I wanted to ask a question about with you real quickly is, do you happen to know how many cases or complaints that have been filed on Guam? Is there any kind of data showing these, attempts for mitigation for wrongful death or any kind of suits or anything like that, or some that didn't even make it? Do you have any data like that?
I do not, and I don't think there is any such collection of data. I myself have probably handled a dozen or so medical malpractice claims over a 42-year career here, so it's not a lot. It doesn't happen a lot.
Okay.
But I can tell you, I have had the experience of far more consultations with clients where they just cannot afford to go forward with it. And that's in the 50s or 60s in the amount that I've had to just say, sorry, if you can't come up with, as one of the witnesses testified, she was asked to come up with $60,000. That probably includes not just arbitration costs, but an expert witness and all your litigation costs as well. But that's not an unusual amount to have to quote to a client of what it's going to cost to ultimately do their case.
So, Robert, you're saying that you've probably tried about 12 cases. However, there's about 50 out there that they don't even get as far as going to you, or is that what you're saying? Or couldn't even do it because...
Never proceeded for lack of funds.
Okay, that's a little bit more than I thought. The other question I had real quick is, do you think it's fair that the physicians that are covered at Guam Memorial Hospital, where there is a cap on anyone who sues a physician at GMH, do you think that's fair for the private sector to have that same, afford that same opportunity to have a cap?
I'm not a fan of caps because, again, it places the burden that should be shared by the community as a whole on that one individual. I think I mentioned the quadriplegic person. All they got in that case because of a cap was $250,000. Was their pain and suffering for a lifetime of living as a quadriplegic worth more than $250,000? Probably. If there were no cap and that case were to go to a jury, I would not be surprised for it to produce a result of $10 million or more.
Okay. And my last question for you, Robert, would be, of all the cases that you tried as an attorney, I'm sure you do a lot of research when going to defend your clients. And maybe you've even gone as far as researching other states and their laws that oversee tort law for medical malpractice. Of your research, what state do you think that provides more of a fair perspective for both the patient and the doctors?
I don't know. I really haven't done that research, but I will say that to give a comparison, a contrast, one of the attachments I provided with my testimony was a decision from the federal court in a case against the United States government where there is no cap. And this was a woman who was rendered paraplegic as a result of what was determined by Judge Tate Inco Gatewood as being negligence. She was awarded $7.5 million. That included not only pain and suffering, but all her future medical expenses and all her future loss of enjoyment of life, and her husband's loss of consortium as well. So without caps, the damages can be high. And that was not a jury that awarded that. That was a Guam judge, a good one, a very careful and thoughtful Guam judge. But based on the evidence, this young woman who was rendered paraplegic was awarded $7.5 million for her injury. And
well, thank you for that, Robert. And you know, I have researched all the states and territories on their laws with regards to that. I was just curious to see which state that you would favor over to provide that balance to both the patient and the doctors. But I appreciate all your information. And
I'd love to see your research and,
Oh,
and give my opinion.
Right here.
Okay.
This thick.
Yeah.
I have done my research. Lastly is, you know, Annalyn, Dr. Carbolito is here today from GMRC, and hearing the opening of your Carbolito, I'm sorry, Cabrera. Debbie's going to kill me if she hears me saying that. I'm a good friend of your sister's. But I was kind of really taken back on your opening. It takes a lot of courage to be here, considering, you know, your father's still at the hospital and under care of physicians. And that's one of the biggest scares that anybody who wants to talk about on medical malpractice and, you know, maybe changing something, that the fear of retaliation. And I'm hoping, you know, Dr. Cabrera, you know, that that's not happening with Annalyn. It's very disturbing to hear. And Annalyn, my number is 989-TELO. So if you have any issues, I'd like you to call me, okay?
Thank you.
Thank you. And thank you, Madam Chair, for the opportunity.
Thank you. Senator Taituno? I mean, sorry, Senator Taituno? For me here.
I will just add my comments to those that have been given already here. It's very important, as you know, to listen to everybody, and I know what it is to come in and testify, and I know all of us here just really appreciate that time that you've taken and the difficulty in testifying. And I remember from the first of the hearings, and then again now, I mean, there's so much that's just really sobering. The issues are so deep. The whole community can be affected by this, and really, with the testimony that you've given here, I think for all of us, it's really made us think deep and hard about these issues. And so, as they've said, we don't have any answers at this point, but I appreciate all that you've gone through to be able to do this and to be making us think long and hard about if there are any improvements to be made. So truly thank you for that.
Thank you, Senator. I also would like to extend my thanks to all of the physicians and nurses who came today to listen to the testimony, those who provided testimony, those who've submitted in writing. Of course, the lawyers who were here last week, and tonight. And of course, the patients and those who with very serious losses or facing very serious risks. I want to just extend my thanks. And I agree with you that I think the more we talk about it, we are all in the same, you know, we're all patients. We all need our doctors. We are all very grateful for our doctors. And doctors, too, are going to be patients. And we're all going to need lawyers. I hear stories about lawyers who won't take malpractice cases because then doctors won't see them, you know. I mean, but I agree with you, Ms. Lagermas, right? That the more open we are, we're trying to get, to what's good for our community, and that's our intent. And I think being very open is going to help us. We have a lack of some data that I think would be helpful, and I haven't also been able to get enough data to satisfy me. Moving forward kind of scientifically, right, or anything like that. So that's unfortunate. But we will take a look at that also. So again, there will be another hearing on November 7th. There isn't any real agenda for it right now. I'm just looking for proposals. I'm going to allow my colleagues the opportunity to, discuss proposals. If you would like to come and help us with this, please come, so we can ask you what you think. We can take your proposals and debate them a little bit or see if we can make them any better. So that will be on November 7, 2019 at 2 p.m. Thank you again. So you may submit testimonies to my office directly at the Ada Plaza Center, Suite 207, 173 Aspinall Avenue, Hagåtña 96910, to the mailroom here at the Guam Legislature, or through email at senatorterlajeguam@gmail.com. So these hearings are always put on YouTube. The recordings of them are always put on YouTube. You can go back and watch them later. Testimony that I receive is always given to the senators, and it will be put online. Thank you very much. Si Dios masi. This meeting is adjourned.